Dah berjemput Najib.
Assalamualaikum dan selamat semua. Kita minta doa dalam bacaan doa yang kita haruskan kita dari masa kepada masa Al-Fatihah. Bismillahirrahmanirrahim. Alhamdulillahirrahmanirrahim. Ar-Rahmanir-Rahim. Maliki yaumiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdinas siratal mustaqim. Siratal ladzina an'amta 'alaihim ghairil maghdubi 'alaihim waladdallin. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Hamdan yuwaffi ni'amahu wa yukafi mazidah. Ya Rabbana lakal hamdu wa lakal syukru kama yanbaghi li jalali wajhikal karim 'azim subhanahu. Allahumma ya Allah yang Tuhan kami berkumpul pada hari ini untuk melaksanakan untuk menghadiri satu kursus bengkel iaitu Hawley and Fabrication Art. Semoga kau memudahkan usaha kami pada hari ini, Allah. Kau berikan keselamatan pada kami hari ini, Allah. Semoga jalan manis ini jalan kasih akhirnya. Rabbana 'alaika tawakkalna wa ilaika anabna wa ilaikal masir wa sallallahu ala alihi wa sahbihi wa sallam walhamdulillahi alamin. Amin ya rabbal alamin. Okey. Sedikit saya nak adakan wakili daripada TBK. TBK dari Azwan mohon maaf kerana dapat hadir pada hari ini untuk memberikan kata-kata aduan. Cik Azwan pun sama juga dan terpaksa backup di kaunter sebab kaunter tak kebanyakan orang email lah yang MC. So dia kena jadi mana kaunter lain walaupun itu kawan. Okey. So saya minta terima kasih kepada semua yang hadir. Terima kasih kepada semua yang sudi untuk melakukan program pada hari ini. Program ini kita cuba buat secara berkala. Secara berkala, kita mohon perlukan, tak apa kita mohon perlukan, makan semua untuk hari ini. Kita makan belakang ni. Ada apa? Kita ada lewat dan break tu kan? Kita ada break kan? 10 lebih. 10 lebih. Makan lagi. Lagi tak? Kita makan lagi. Terus hari ni kita makan lagi. Kalau kita makan lagi. Makan. Okay. So, saya makan kita just santai. Duanya yang berubah walaupun kita kat sini tak ada waktu kita makmal tak ada. Sebenarnya makmal memerlukan penyedia tolong pastikan makmal tidak terganggu. Itu saya nak. Terima kasih Dewa kerana effort Dewa untuk buat ni. Dia buat saya serahkan kembali kepada Dewa. Jangan makmal kita pada hari ini dan lancar ya. Terima kasih Dewa.
Okay, terima kasih Encik Najib. Once again, selamat pagi dan selamat sejahtera and very good morning to all. And thank you untuk join workshop kita pada hari ini. Workshop kita hari ini berkaitan dengan Hawley Retainer Science and Fabrication Art. Everyone semua ready? Ready. Okay. Abi macam lepas makan macam tak kuat lagi. Ready? Okay. Before I start, saya akan perkenalkan diri saya dulu. Walaupun semua kenal, tapi saya akan memperkenalkan diri saya sebagai trainer untuk hari ini, one whole day. Kita ada mempunyai 3 modul. Nanti saya akan introduce. First, okay, this is my profile. So saya akan gunakan 2 bahasa, mainly on English and also mixed with the Malay. Kalau ada tak faham apa-apa, boleh tanya saya directly. I will explain bahasa Melayu. Okay, and basically my name is Diwagal and I was a qualified dental technologist and holding a few other certificate in law and also auditing and also as a psychologist, ADHTP practitioners and CBTH practitioner. And this a small introduction about me. And next will be the whole day what we're going to learn and what's the learning outcome. So at end of this session, the participant will be able to first you'll be able to explain the history and the evolution. Second, the types of Hawley retainer. And sebab as a dental technologist, kita boleh tahu kita ada perbezaan, kita kena tahu dia punya asal usul sesuatu appliance component, dia punya prosthesis semua. So it's very important for us. Basically we know the history behind each component and the types of Hawley retainer. Second outcome that you will learn based on this workshop is you'll be able to describe the evidence-based application, because everything in dental is based on the evidential idea. So the first thing, you know the ideal requirement of the Hawley retainer, advantage and disadvantage by using the Hawley retainer. The third thing is the usage hours, because each clinician or each dental technician will say different things. What's the advantage, what's the disadvantage, and the usage hours, which we will be explore later part, which will explain more and further on this. And the final thing, the most interesting part, as a dental technologist, we are used to fabricate, design. So this is the most important part in our session, which is the wire bending techniques. Second thing is the best practice in using materials, because we got a lot of different kind of materials which will be introduced later part. Some maybe you have come across, some you think maybe it's a very new, but never come across. So this will help you. Third thing is the customization. Even the wire bending, you can do a customization. Okay, next kita akan buat satu ice. Hold on. Battery. Hello. Masih Syam. Okay. Tunggu bateri ni. Okay. Third, masih Syam. Hello. Third thing is about customization. Even wire bending pun kita akan buat customization, di mana kita even the tag for Hawley, especially we play with the tag, with the colors of the Hawley, such as you all can see here in front had about display. You all can see later what all different kind of acrylic, the colors, the wire bending techniques we are using. This is one of like something extra advanced. So the third thing, next kita akan buat satu ice breaking session. So hope you all will be enjoy this. And one of the important thing is, please take one balloon and write what is your expectation to achieve through this one-day workshop. So ambil kayu give to everyone. So apa yang kamu nak expect? Tolong tiup balloon. Lepas tu write in the paper. You know, not the paper, in the balloon. Ini share. Yeah, you blow the balloon.
I don't want to blow lah.
Hah? Kena blow. Lepas blow baru boleh tulis. Lepas blow baru tulis atas tu. What's your expectation? Then ask someone to help. We make a buddy system. Trainer pula kena. Hah? Blow dulu.
Tonda ரொம்ப sensitive.
Apa sensitive? Masih lebih dekat tu. Okay, lepas tu tulis what you expect dalam workshop ni. So basically tahu kan title kita Hawley retainer. Science and Fabrication Art. So, nak tahu tentang apa? Puan Hafizah, tube besar-besar. Puan Yong Kai praktis. Janji boleh tulis berapa banyak pun okey. As long kamu punya expectation, kita nak meet. Tengok kat Puan Norish sampai lukis muka bulat. Mungkin lukis muka, lepas tu tulis apa dia nak achieve. Okey, dia tengok Cik Isham. Faham apa? Learn and refresh knowledge about Hawley retainer. Too much dental chair. Training about Hawley. Forget about Hawley retainer pula. Cik Syam, pinjam. Ini adalah salah satu contoh Cik Syamnya. Ini tak boleh bagi tips. Ini expectation sendiri. Ini macam tiru pula. Puan Yong Kai, baby nak belajar Hawley retainer. Which one bigger? Tengok Puan Yong Kai, dia kata dia nak anak dia belajar Hawley retainer.
Sharing sikit.
Tak boleh sharing. Kita nak buat dia benda baru.
Make sure semua tulis apa kamu punya expectation. Puan Lima, dah tulis apa kamu punya expectation. Fikir. Lock back. Sebab lepas ni ada lagi satu game.
Boleh jadi satu buat.
Mic tu okey lah.
Kan boleh tiru kan?
Tak boleh tiru. Sebab setiap orang masuk workshop ni pasti ada expectation dia sendiri. Ini nak macam tiru, nak kanak-kanak Raibina pula. Hawley retainer. Selamat datang Encik Rosli. Ada balon untuk Encik Rosli tak? Encik Rosli macam bunga, dia nak pink.
Duduk je lah, tak ada orang.
Tu lah saya tengah fikir. Duduk, saya punya. Apa duduk lah, sini kosong.
Tiup balon ni tulis expectation daripada kos ni.
Tengok
Apa yang nak Encik achieve daripada workshop ni?
Tak nampak.
Aku gambar.
Kimat?
Dah ada.
Tengok.
Mana yang boleh
Oh, bertukar pendapat dengan bertukar tempat. Menambah ilmu pengetahuan.
Nak foto.
Learn and improve my knowledge. Yes.
I love you so much lah.
Handwork of Hawley retainer. Get the nice result for handwork of Hawley retainer.
Abang cakap je, I already know how to do.
Better the skill wire bending Adam clutch. Cik Rosli fikir nak jadi bunga ke?
Oh, Abang Rosli kata, I already know how to learn.
Saya nak tu teknik sebenar.
Lagi apa?
Yang teknik sebenar. From auto.
Ini daripada pakar. Encik Rosli pakar.
Kata teknik sebenarnya. Langsung kan? Tak yalah buat bunga. Belum lagi, memang belum.
Habis lah ini. Ini macam nak bagi. Okay, semua dah siap? Semua dah siap tulis tak? Dah. So, keep this to your heart. At the end of kita punya program training hari ni, kita tengok capai tak kita punya target objektif ini. Dan kita boleh blast. Jangan sebelum tu blast pula. Itu ni kamu dah capai dah. Sebab kita kena tahu kamu punya expectation and what is your expectation, whether we achieve through this training or not completely. So kalau if you have achieved, at last you can blow. Or maybe you can keep somewhere or at the side as long as you remember. Mungkin you can keep at the corner of this side also can. Kalau later maybe you can keep at the corner of this side, but remember your writing everything. Okay. Next question is, we want to differentiate what is the qualified dental technologies versus unqualified dental technologies. Benda ini banyak penting for us to know, understand what's the difference between qualified dental technologies and unqualified dental technologies. We know all of here is a qualified dental technician. So through this program, even though it's a topic related to the Hawley retainer, the basic is very important foundation, which most of the unqualified dental technicians is not having. So I just want to get an opinion on what's the difference between qualified and unqualified dental technologies.
Qualified and unqualified. Selamat pagi, good morning. Qualified dental technologies, they will do fabrication of any prosthesis or retainers. First, theory is very important.
That's true.
So it's based on theory. So with the learned knowledge, they are able to produce a functional prosthesis or retainers. Whereas unqualified dental technologies, they will only produce the prostheses and the retainers based on their experiences, where they might not know the exact theory or the purpose of the retainers or the prostheses. Maybe they won't know the functions. So they just do based on whatever is given on the card, written card. So they just follow and they just complete the cases. That's my personal point of view. Thank you.
That's correct. Correct. I agree with that. Yeah, what Puan Suta is telling is exactly correct. And we will ask one more thing, one more person. Cik Syam, what's the difference between qualified and unqualified dental technologies?
I speak Malay. Oh my, standing lah. Dalam dunia dental tech, masa dulu saya masuk, dia ada dental tech ni, dia ada macam if you go to UKM, they have their own style. They cannot open to the new
idea
generation ataupun new punya education. Tapi makin lama saya dah masuk dalam dental tech ni, kira acceptance to others opinion dah makin bagus. Sebab dulu saya first masa masuk dental tech, even our lecturer pun dia tak boleh dengar, kata actually you punya last time dalam auto finger space like this, like that. Tapi bila saya dah duduk lama-lama kan, we come up with the decision that our junior is right. Last time about the finger spring lah, the argument is that, but kita, it's not about ego, but it's about education. For me, qualified dental technologies is the person that can accept changes. Now we go to the technologies digital, so we need to change. For me, the qualified, you need to change.
Change and moving forward.
Yes.
Okay, thank you Encik Syam.
Oh, betul ya tau.
Tapi exactly because different people have different opinion about the qualified and unqualified dental technologies, and we asked our pregnant mummy, what's your opinion?
Mommy must be thinking he's not.
Answer me later. Okay. Never mind, mummy. Slow a bit. So mummy dah waiting for due date. Okay, this is actually $1 million question. Why I'm asking this because in University Malaya, we know everyone is qualified dental technologist who are holding a certificate of diploma, post basics, and etc. In the outside, in the private practice, many don't have the certificate. So anyone can do the wire bending, can do the prosthesis, can do the restorative crown, bridge in outside. But not everyone understanding the basic, the foundation of the science. That's why we do a lot of research. Why the outside, the doctors, the dentists, the dental technologists do research and coming out with solutions? Because that's what we move a qualified dental technologist forward and differentiate between us as a qualified dental technologist and unqualified dental technologist. We know what is the reason behind everything, every judgment, everything have a reason. That we need to follow the protocol. So that's the thing, and thank you everyone. And now we will start for our real lectures. And before we start our real lectures, I will explain about what we're going to do today, whole day. And the first thing is about the content for today, the whole day, what we're going to do. So at least you get some kind of idea to process and what we're going to do in next. So you're not going to be blurred or blindfolded. So we have come up with 3 modules. The first module is the most foundation, the introduction of the history and revolution and the types of Hawley in the world. But I'm not going to explain all the Hawley because under the root or under the roof of the Hawley retainer is like a lot. So I will pick the most common Hawley retainer that will be in the market or in the field of the orthodontics. Second module, I will divide into what's the ideal requirement. the advantage and disadvantage usage hour. The second module is more on the scientific finding, more on the what's the evidential based finding, which is important. As what I say just now, that's what differentiate a qualified dental technician with unqualified dental technologists. So when you know, okay, what's the purpose of the Hawley retainer in such a way, the ideal requirement, what's the advantage, what's the disadvantage. That's why we can explain, as a qualified dental technologist, we can explain to any patient, any doctors, any specialist that, okay, this is the reason why we bend like this. This is the reason, comfort for the patient. So by through these things, we can gain the confidence that we are knowledgeable. But in case you are unqualified, you are based not on experience. They just do blindly. Okay, you ask me to do A, I write A. But they don't know what's the purpose of we writing A. They just say, okay, you ask me to write A, I write A. But if you ask a dental technologist, okay, we write A in such a way because the science say like this, and this is very important to differentiate. So to prevent any hazardous, any harm to the patient, because we are all our material, our stuff, the invention, our prosthesis is not for external use, all used for the patient, for intraoral, most of the things intraoral. So it can harm the patient. It can lead to different disease. That's why we have the infection control and etc. And the third module will be in relation to the fabricate Hawley, where we will do the Hawley retainer fabrication, wire bending of the label bow, and also the Adam clasp. And we will show a live demo later, hands-on. This will be take longer. The module 1 and module 2 we will finish faster. And the module 3 will take a longer time because we need to fabricate the wire bending. Second, we will use the teach about the best practice in the material. What kind of material in the market? Because in University Malaya we have certain material and certain material we are not having because due to the limitation, the supplier limitation to bring in a lot of advanced material to Malaysia. And third thing is the customization. As we say, as a dental technologist, we are so creative and innovative. We can come up with different kind of appliance, material, the wire bending technique. We can say overall here, each of us having a different style, but at the end, the product will be the same. If I bend Hawley retainer different style, Puan Samira, Puan Cik Siti, we bend it differently. But at the end, the product, the final product is the same thing. So that's why we say customization. For example, just now what I show you all, even the customization of the base plate. Some will come up with the colors, some with the glitter, some with the sticker. It's like you are so creative and innovative. What bring we are actually very special dental technologists. Okay, this is the whole process cycle. I make it a simplified. Just now it's the content. The whole process cycle is we start with the history. As I say, we know how to do, but we don't know who has founded that. We know, okay, I know how to do ocular, I know how to do the cobalt chrome, I know how to do crown, but who is the basic, the main founder, we don't know. So we need to know at least the basic as acknowledgement for the founder. Second is the types of Hawley. Then the ideal requirement to fabricate Hawley, what is the requirement for the patients, everything. Advantage and disadvantage of using the Hawley retainer, because they got a lot of retainer. One is like a Hawley retainer, or you can opt for S6 retainer, which we call as a vacuum form retainer. Some place they call as a VFR, vacuum form retainer. Some place they call as S6 retainer. So don't confuse. And some even call it as a thermoplastic retainer. So don't confuse with all these terms. That one also is a kind of Hawley retainer, say similar function with that, but they have some kind of advantage and disadvantage. And third thing is the usage hours, because every time, even anyone have wear the braces? Siapa pernah pakai braces? Kai, Puan Shuba, Puan Hafiza pernah pakai braces? Pernah. Okay, so pasti semua lepas habis treatment, habis buat debond, pasti ada doktor akan bagi retainer Hawley ke atau S6. So mereka ada beritahu tak berapa lama kena pakai Hawley retainer dalam sehari? Puan Hafiza? Janganlah malu Puan Hafiza, bukan cari pengantin lagi.
Lagi lah Doris.
Kau tak pakai.
Tak, saya tak pakai.
Dah lupa.
Apa?
Dah lupa.
Okey, sebagai juru teknologi pergigian ortodontik, berapa lama pemahaman puan?
Untuk tak jalan lagi.
Dalam sehari? Boleh. Dalam sehari pakai berapa lama? Sehari penuh ke atau half day ke atau 1 jam ke?
Sehari pakai kecuali makan.
Kecuali makan, so whole day.
Kencang.
Kalau berapa? Tak apa, whole day.
24 jam. Ada masa 1 hari 24 jam kecuali makan sahaja.
Okey.
Wait, excuse me, but I want to ask.
Yes.
The function of S6 retainer, VFR and thermoforming is equal with Hawley retainer, is it?
Actually, it's more or less same, but Hawley has some kind of activation purpose. Like VFR is just for retentive purpose only. It's just holding your teeth. Later I will explain, followed by I will explain what's the
Three
difference.
names is referring to one same appliance.
No.
No
S6
different.
VFR is like a plastic one, like this,
Okay. Yeah.
like this. While Hawley is more on the wire. So actually they have a different function, which I will explain as we going on. Good question. Maybe I can later I can.
These three things. I want to know S6, VFR and the thermoforming.
S6, VFR,
same.
S6 and VFR is same. S6, VFR, thermoplastic, the three things is actually same.
That's why I want
Just
to
they got a different meaning on it.
Different names,
Name,
but
that's all.
referring to same
Same material.
Material. Okay. Thank you, Liva.
Okay, Puan Shubha.
Whole days, but except for masa nak makan kat keluar lah, that's all.
Okay, masa nak makan saja. Yes, most thing I nak pakai braces. Everyone telling that we need to wear the whole days, but whether it's true or not,
Sorry,
we will
what? Hawley retainer.
Hawley retainer or S6 retainer, we need to wear whole days. But whether it's correct or not, we will tell later part in the lectures.
My doctor tell me different things.
See, Puan Kai's doctors tell different things.
My one is the proper way. So
Okay, never mind.
after I divorced, it is wearing during night time. It continues for 3 months, and after that, automatic. I think maybe depend on the treatment plan, and then depend on the adjustment of the teeth. Maybe my one is a mild adjustment, so no need to wear so long. I'm not really sure. That's why I confused why they say have to wear 24 hours.
Okay, so you can get some clarity why I asked this question. Because each doctor's, each clinician will tell different things. But whether it's true, whether clinician that handled Puan Kai is correct, or clinician consult by Puan Hafiza and Puan Shubha is correct or not. Because Puan Hafiza and Puan Shubha are telling that you need to wear 24 hours except during the eating time and the brushing tooth, I think. Yeah, of course, on these 2 times. And like Puan Kai's one, you wear for 3 months full time, and another alternative already after that. Okay, later we will see all this whether correct or not. Because even dental technologists have this confusion already. Right? How about a lay person who don't have any dental knowledge? Okay, next. So this is our module. First module about the history and the revolution of the Hawley retainer. And anyone know who is the founder of the Hawley retainer? Nama penuh? Hawley memang semua berhantam. Encik Hari bin Hawley. Okey lah, bakal Hari bin Hawley version 2. Version 2.0. Okay. Hawley retainer actually founded by Dr. Charles Augustus Hawley in 1919. So ini gambar dia. And the first invention yang basically mereka lukis balik daripada buku yang ditulis oleh Dr. Charles Augustus Hawley pada 1919 adalah ini. So this is first Hawley. Nampak tak? Dia punya Hawley dengan sekarang punya Hawley totally different. Kan? So sekarang Hawley macam ni. Those days Hawley dia punya base plate pun lain. So actually anyone I have idea what material they use? Untuk base plate those days. Sebab acrylic resin ni di-invented dalam tahun 1960 macam tu.
Metal.
Gold.
No. Okay, kita. Okay, so remember this gentleman who is the make the history and where we are today actually.
They use rubber.
Yes.
Rubber.
But the rubber there have some kind of mix. So I think memang ramai yang kita buat Hawley hari-hari tapi kita pun tak tahu nama. So at least kita dah ada knowledge benda ini. So as time going on, the Hawley retainer gain popularities and a lot of modification takes place. They try to cuba sebab at starting kita nampak starting tak dia punya wire semua macam ni. So whether it's comfort for the patient or not is another question already. That's why they try to do the modification among orthodontists to come up with the best treatment, best Hawley retainer. And after the development, the acrylic resin by the Stevenson improvised the Hawley retainer, where he using acrylic instead of vulcanite. Vulcanite is the one actually saya kata tadinya base plate kan. Actually base plate itu dia gunakan rubber that mixed with sulfur, which we call it as a vulcanite. The first patient yang guna oleh orthodontist yang dicipta oleh orthodontist vulcanite in the 18th century. In the 18th century, vulcanite is being used for the first patient. Haisan Cik Arifin suka kot. First patient yang gunakan vulcanite ini adalah cleft palate patient. Sebagai base plate. Sebab cleft palate patient having issues, so the orthodontist who invented the 18th century, he used the rubber mixed with the sulfur and undergone the process to become the base plate to treat the cleft palate patient, and he's an orthodontist also. So after that, only in the 1940, 1960 something like that, the resin is coming in, which is the heat cure we are using, the polymerization technique. That's where they're make it simpler and economic, because the vulcanite process memang lambat and very costing, and it's not a pure comfortable for a patient. So when they're coming out with the resin, the polymerization technique, then the Stevenson is improvised the Hawley retainer. But over the time, still the popularities and modification going on, and the last, Philip Adams in 1953, who invented the Adam class. Sebelum tu, they don't have a Adam class. They only having like C club. They do all kind of joining like board end. And Philip Adam, who is the one invented the Adam club, and they modified the Hawley retainer. The first idea who invented the Dr. Charles Augustus idea. From that, he bring in, modify. After Stevenson, then finally the Philip Adam who come out with a complete Hawley retainer, which we are still using today. Like this, with the two Adam on the 6th, Adam club on the 6th, and the label bow. So this way is gain the popularities. So next, we'll be going to the types of Hawley retainer. So there's several types of Hawley retainer, and because the most common type of the Hawley retainer is like short label bow we're using. And the function is basically actually to maintain, to hold the position, because after your treatment, after you debond your braces, your bone will become very soft. So when you are chewing a chicken, any hard stuff, your teeth will become misaligned, become out occlusion back. They tend to move. After treatment, you punya gap semua dah close, tapi tiba-tiba bergerak balik gigi. Dalam 2-3 bulan bergerak balik, because dia ambil masa. Lepas kamu makan, dia akan ambil masa, dia akan bergerak. So what's the point if you cannot maintain the position? Because the bone is still soft for your teeth movement. One thing difference between like orthodontic dental technologies, prosthodontic dental technologies, and restorative dental technologies, orthodontic dental technologies, they start to need to think about the future, the protocol, the treatment planning. We always need to ask about the treatment plan. We always ask the doctors, the orthodontists, doctor, what's your treatment plan? What teeth you want to move? What tooth you want to move? What's the purpose? So what you want to achieve? So that's one thing as an orthodontic technologist, orthodontic dental technician, we will always ask that. So the doctor will say, oh, I want to move the canine in. So we need to think about future, whether because the component we can make it as an active component or retentive component. When it's active, we need to predict the movement. That's where we come as the protocol of the movement and the treatment planning. So the movement protocol is very important, which I will explain a little bit later, the protocol movement. So we need to get the idea. So basically in the picture one, actually this is a short labial bow. So all this will be holding the position. But you can see here is some gap. Later I will explain. Even though it's already deborn, the treatment is being completed, but why the doctors, it's because some will say, oh, it's not complete because there is some small gap here. Right? There's a small gap. Maybe you look properly, you can see a very minor, I think should be 1 mm, 0.12 mm like that only. So later I explain. And this one is actually it's a back retainer. Actually it's not a short labial bow, actually it's a back retainer, the second one. Okay. Later the back retainer is also one kind of under the roof there is a family of Hawley retainer like that. And all these have a unique characteristic. Despite it's a kind of Hawley retainer, each of them having a different characteristic. Okay, this is the Hawley retainer short labial bow. So you can see the movement is here. Not the movement, the wire bending for Hawley, the labial bow is until the canine, the Adam. And this one is the Hawley retainer with soldered labial bow, where you can see it's already been soldered. Even though the Adam class in the 6th, the first molar, the labial bow until the canine, the U-loop, and also it will attach to the bridge of the Adam class. So that's why it's a Hawley retainer soldered labial bow. Itu yang cari bin.
Kalau you look so, kalau tengok dalam page yang yang purple, that's you look, dia punya tips yang apa tu untuk activate dia sepatutnya on the center, on the tooth dia.
Yang ni.
Yes, yang L.
U tu.
Yang starting the L.
Okey, itu masa later I will place hands on, saya akan beritahu dekat mana dia akan start. So yang tu dia ada difference.
Dia ada, saya nak tanya soalan sebenarnya.
Ya.
Adakah apa ni? Macam yang ni, adakah version lain ni?
Actually we have a standard version saja. Tapi certain clinician, because sebab dia punya treatment plan, dia akan ubahkan dia punya position. Kadang-kadang dia nak letak dekat dengan premolar pun ada. Tapi the standard version adalah daripada canine. That's the standard version. Tapi kadang-kadang doctors mereka nak try, sebab mereka kadang-kadang mereka dah try dah dekat canine, tapi dia tak bergerak, mereka nak gunakan mungkin wire untuk gerakan dekat premolar. So that's why kita akan movekan dia punya position of the U-loop. Ada apa yang ceritanya betul ada. Kisahnya tu, di mana doktor tu dia tak nak dekat canine, dia nak benda tu dia gerakkan kepada premolar, daripada first premolar kepada distal of the premolar. Then the third Hawley is Hawley retainer with a long lip. Yes, Cisha.
Cakap, I just want to share lah. Before this, I punya teacher pun bit lain tau from this orthodontic but we come up and standard version like we said lah, they look the middle of canine, that is standard version. Tapi from others teachers, they come up macam-macam. On my first jadi toto by theory, then we come up with solution. One day we compose the theory and then make the
requirement,
the standard version of UM. But to say no, that yang tu salah atau tak, kita pernah masa dalam meeting pun from Dr. Wei, dia belajar kat Hong Kong, differentiate. I from another teacher pun differentiate sikit.
Gambar kebetulan daripada segi soalan di sana. Okey, kalau ikut daripada label book, yang L tu, yang L yang
You look actually.
yang bentuk shape apa dia? Sorry, di bawah. Mana di bawah yang apa?
The last one.
Okey, kalau yang L yang ni, this is activator, starting for activator sebenarnya. Tapi kalau boleh tak reverse balik? Okey, kalau L dia dekat sini, ni saya cuma persoalkan ni je. Bila L dekat sini, so bila activator untuk force the tools, okey, untuk bila dia click kan, bila dia activate that new loops, adakah dia punya strength tu cukup? Itu je. Lepas tu saya tak nak persoalkan you, cuma saya nak persoalkan adakah another teknik sebenarnya.
Okay.
Itu je.
Actually wire up as a good question. Actually gunakan wire 0.7. Actually wire itu memang kuat. Even kita selalu akan activate untuk movement pergerakan gigi, even 0.5 mm. Kita guna 0.5 mm untuk gunakan untuk finger spring, untuk Z spring, untuk gerakkan gigi lateral incisor. Memang 0.5 pun dah boleh gerakkan gigi dah. Kita gunakan 0.7 sebab kadang-kadang tadi as I shown, dekat sini kan ada gap kan. Because this one kita kena gunakan protokol sequential retraction, sequential retraction. So sebab dia punya gigi banyak, 3 to 3, 6 batang gigi. So 0.7 wire dia akan tarik. Dia memang kuat. Kalau satu batang gigi kita boleh gunakan 0.5 mm sebab it's more flexible. By 0.7 is thicker. Nampak macam 0.7 saja tapi memang sakit. Patient memang akan sakit. Kalau doktor, clinicians activate very hard, the patient tend to pain. Sebab pergerakan gigi tu memang kita akan kira untuk selalunya macam I think in UM kita akan guna 0.5 mm per week untuk pergerakan. But in outside sebab mereka nak treatment mereka cepat, so mereka akan gunakan force 0.20 pergerakan per week. So bila gunakan 0.2 mereka akan activate more. When they activate more to retract 0.2 mm per week, dia patient akan sakit. Dia akan lebih sakit. So yang protokol tu nanti saya akan beritahu lah. Saja dekat protokol kita as a dental technology kita tak perlu tahu because I'm doing the Invisalign planning. So from that I start to know what is the inclusion, exclusion, which I will tell later part. So the shoulder label, third type, and this the horizontal with long label. Long label is not the U-loop is not started from the canine. It will be at the premolar here. And fourth one is the acrylated label, where is the label will be acrylated to hold the anterior position of the teeth. Because normal label sometimes is not holding together, it's not covering 3 to 3. In case sebab because usually we have canine and lateral. Bila kita buat label bow, usually in our understanding, usually label lateral incisor will be 0.5 mm inside and central incisor will be a bit outwards. So when we bend the label bow arch, it won't touch everything. It won't touch everything. We try to maximize touch as much as possible. Sometimes we only able to achieve 4 tooth, canine, central incisor, 2 and 2 canine, so 4 tooth only out of 6. Because lateral incisor is slightly inward. So to maintain the position, they use the acrylated, where the acrylic is holding all the teeth. So when even the doctor want to activate, it will go move together. It won't misalign. It will achieve together the 6 tooth. We maintain the position to close the gap together. So can understand about the acrylated, why some doctors they prefer acrylated, because the acrylated one can control the movement a bit. It's a predictable movement. Yeah, they will retrocline. We call it as a retrocline. Yeah, it will retract backwards. this is a split labelable, which is to close for the midline diastema. Usually patient having this side all have closed. You can see this side all have closed. Only this side have a midline diastema. So the doctor don't need to wear the braces. If the patient only have the midline diastema, they will do some patient they having a kind of papillate here, which cause the midline diastema. So they will do a minor surgery to remove that, and they will use the appliance like this is one kind of Hawley retainer, but it's not Hawley retainer. It's the family. So because it's a split labelable, then they will just use this one to close. They don't need to wear the braces. Actually, this is more on the clinical part, but based on the experience and my studies, my understanding, I was explaining this, what will happen. They do a labiosectomy, if I'm not mistaken, they call it. So, they will close the midline diastema without the braces. They just use this one. Okay, and they also have other appliance under the family of Hawley retainer. We call it as a back retainer. Just now the first one I show you all. Back retainer and reverse U-loop. Reverse U-loop is usually a normal Hawley that we have the things labelable, the U-loop here, but this one it won't like this. The reverse U-loop it will come until here. Then only we reverse and go back. So the labelable arch wire will come until the distal of canine. Then it will reverse, then go back. And if it join and soldered, become a soldered labelable. So don't confuse why got so many. But primarily we only use the short labelable and very common in the dentistry. The short labelable, the first one. This is the most common one we use. Short labelable where is cover until canine. If the reverse you look, it will come until the canine, then only it will reverse, then it will connect here. Okay. So next we will go for first quiz. Quiz. So minta ambil QR scan lah. Soalan senang je. Boleh scan tak? Tak nampak ke Encik? Yeah, your name just. Yeah, correct. Yeah, just enter your name. Just masukkan nama, so kasih akan appear. Okay, 1, 2, 3, 4 orang dah. 7, 8. Huh? Yeah, got ready. See, got 10 participants, see, got few more. Haven't start. I didn't click start. Ui, sampai hantar low semua ni. Semua scan ah? Cherry pin. Dah. Wih, ini love tak habis-habis ni. Oh, Kak Fiza. Apa Kak Fiza hantar apa ni Kak Fiza? Ketam. Wih. Saya panggil main game quiz, kamu main benda lain pula. Okey. Ya, saya start. Oh, tunggal jari pin lah bos kita. Boleh?
Saya bagi love lah sikit.
Belum start game dah enjoy main love pula. Okey. Ini reaction. Okey ya, saya start. So 18 participant dah. Kita tengok siapa cepat, siapa menang. 2 soalan saja. Baca soalan betul-betul lah. Peserta. Okey eh? Ana? Okey. Hui, long guy dah Hisha handsome. Okey, tapi benda ni saya tak bagi hadiah. Hadiah untuk last siapa buat wire bending cantik. Itu saya akan bagi hadiah. Hadiah besar tu. Ada 3 hadiah besar punya. I don't know how to Okay. Okay, now it's 10 o'clock. We will go for next module before we go for a break, short break. So the next module is about the ideal requirement of Hawley retainer. So the first is for a Hawley retainer, when we want to fabricate, the few things that a clinician and dental technologist need to be take into your mind always is this 4. That the appliance we fabricate, the Hawley retainer, should maintain the arch and should hold, don't have any rotation. This way I say. Okay. The appliance should prevent the rotation of teeth after the treatment. Supaya just now I say kan, bone after the treatment, after the debone, kita punya gigi punya bone akan soft. So lepas 2-3 bulan kita makan tanpa retainer, tanpa S6 retainer, tanpa Hawley retainer, gigi akan bergerak. So to prevent that, we use the Hawley retainer so that there's no rotation take place. Second thing, should maintain the corrected functional occlusion, periodontal health and muscular balance with achieved by the orthodontic treatment. Dia kena lepas treatment. Kenapa kita buat braces treatment? Anyone have idea why we do the braces treatment?
To correct the malocclusion. To correct the malocclusion.
Yes, correct. So after we correct the malocclusion, we don't want the things back to the same thing like malocclusion back to prevent the teeth lapse. So that's where we need all this appliance. We need to craft, we need to design, we need to fabricate to hold the correct the functional occlusion where after you do the class 1 already, it need to be maintain the position so that it's not go back the cross bite, under bite to prevent all that. Because if not, your teeth after some time there will have some gap over here. It start to move distalization, something like that, and have gap. Some the teeth will from normal class 1, the overjet increase to become procline. So your whatever you have achieved after your treatment will be gone. So you wasted your 2 and 3 years. That's why they asked to wear the Hawley retainer to maintain the position, the functional occlusion, the periodontal health, because the periodontal health also is very important. If you design wrongly, the force of the wire can tend to resorb your tissue. So you start to see the cervical there, the root, the tissue start to resorb. So it's very important for that. And it should hold the expansion of the form of the arch. Because sometimes our upper arch will be smaller. So after the treatment, you hold the arch, expand your arch already with the palatal expander, all this kind of appliance, fixed appliance. So your debone already, your teeth is in the correct position. So once the arch should be maintained. So if you didn't maintain with the Hawley retainer or the S6 retainer, it start to maybe the gap, the arch won't be the same. The fourth thing is the retainer that we use should be biocompatible, economical, easy to clean. This most important is the biocompatible. That's why I say today's world, you can in Malaysia whatever material you want to use, it should be biocompatible, should not be hazard, should not be toxic. That's why we need to get the material that is get approval from the MDA. Everyone is scolding why everything must go through MDA or MDA. Yeah, they need to be monitored and make sure whatever the patient use is a correct material that approved. We can bring in this in China got a lot of material, but most of it we don't have a certificate. So in case anything happen to the patients, who going to take the liabilities? Sure, first person is the doctors. So what doctor they say? I hire a private lab, so I don't know anything. For me, I just pay the money, so they bring in the laboratory. Even though in Malaysia, I don't see yet happen, but it could happen, where they will start to sue. At the moment, they sue the doctor, dentist, like that. But as sometimes go on, I think they start to sue the lab, because now the lab start to produce a lot of material. We don't know whether it's really biocompatible or not. So that was the ideal requirement for you to fabricate a Hawley retainer. You need to take into your mind all this before we fabricate, we are designing. The most important thing is the safety of the patients. Second thing, the happiness of your client, the dentist, whether he's happy with your work or not. So next we will discuss about the advantage of using the Hawley retainer. Like just now what I said, the ideal requirement, the better periodontal health, it should be highly durable, it should be can be customized, the occlusal contact are better achieved with Hawley retainers. Just now I was saying S6 retainer is a kind of Hawley retainer also. Why Hawley retainer is better than S6 retainer is when in case when you use the S6, today's world everyone go for a clear aligners like thermoplastic material S6 BFR, because they don't want the wire is being exposed. Because once you wear the Hawley retainer, when you smile, the wire will be exposed. So sometimes, what is inside your mouth? So it's kind of stigma for people. So they prefer to use something like Invisalign, like invisible. It's like a clear plastic. The problem won't be achieved as much as Hawley retainer is few reasons. One, when you wear SX retainer, this one is covering your occlusal part. So it's around 1 mm or 2 mm. If you use 1 mm, so if for upper and lower, a kind of plastic, your occlusion won't occlude totally. It won't occlude totally. Dia akan ada satu layer plastik. So at moment maybe dia tak akan dapat occlusion yang sempurna. So if Hawley, it not covering the occlusal part. So when upper and lower is biting, it will bite nicely.
Yeah.
So that's what they say, the occlusal contact are better achieved. Sebab dia tak ada a layer of plastic that covering the occlusal. And actually, all these are taken based on the journal. It's not my own idea, it's not my own things. It's basically everything is from the journal, which is published, which is being accepted. So that's why I say today's things will be based on the evidential-based application. So the disadvantage, Hawley retainer is more costly compared to the vacuum form retainer, because Hawley retainer in market, like in Malaysian price, we can charge up to 150 ringgit. But for clear aligner S6, we charge 80 ringgit, 60 ringgit, even some charge 60 ringgit, because it's much cheaper. Because one sheet is around, we can get around 5 to 10 ringgit. And the process is very easy. You just start using the thermoforming machine, and to get that one is very fast work and much cheaper. That's why Hawley is more costly, because it's involved your skill, hand skill, your material. The material use the polymerization or heat cure, or you want to use the cold cure, or you want to use the autoclave material or light cure. And patients start to have a lack of confidence, because as I say, when you smile, your wire of the arch wire, your labial bone will be exposed. People thinking what inside the mouth. But I think now today people start to slowly adapt, because people dah start to nampak aesthetic. Oh, benda tu one kind of a modern kind of among the youngsters, people start to accept, oh, this is a style now. Even though dia punya occlusion semua cantik, tapi ada juga patient saja-saja pakai. Pernah ada case saya buat untuk treatment plan untuk Invisalign. Saya nampak gigi dia cantik, apalah saya nak buat treatment ni. Saya tanya doktor, apa treatment dia nak, sebab gigi dia cantik, saya tak tahu nak move gigi mana in the digital. He say the patient, he just want to wear a few set. Saya kata few set also few thousand already for the Invisalign planning. Then we just do like that. And adverse effect on speech. If you wear the Hawley retainer, you akan nampak something, a foreign stuck inside your mouth. When you're talking, you're hitting the base plate. So the speech will be affected, because you don't have your natural palate. You are not touching, your tongue is not touching your natural palate. It's touching another artificial palate. So your speech will be tend to affected. So third thing is less accepted Hawley retainer because of that. Because it's like exposed, costly, and can affect the speech. That's what's the disadvantage of Hawley retainer. But still, this Hawley retainer are really playing a big role in treatment of the midline diastema to close the gap after the debone cases. And okay, yeah. Next will be the usage hours. Ya, macam tadi Puan Hafizah kata, we need to wear whole days, but only take out during makan dengan berus gigi. Okay. And Kai say she wear for 3 time full time wearing the retainer, and after that will be interval. Right. So we see whether it's correct or not. Actually, according to the journal, patient to wear the retainer only for a time of the bond and a period of full time retainer was wear is not necessary. It's not necessary you need to wear full time according to the journal. But some clinician is advising you need to wear full time, because there's a journal, a research was published. Group A, they wear for full time for 6 months or for 1 year full time, and another group is they're wearing 6 months for full time, and another 6 months for only night time. And they found out the result more or less same, not much big difference compared from the full time wear and to the people, the group B who wear the part time at the night only. So there's not much different, and it's very based on clinician. Like clinician done by Puan Yong Kai, she say just wear interval. After 3 months full wear, you just wear interval. Like Puan Shuba and Puan Hafiza, you wear full time. So it's based on actually according to journal, there's no much difference. but it's compulsory for you to wear. Even after the treatment, even after 1 year, 2 years, you need to wear, because if you maintain somehow, you maintain, because as time goes, it will relapse. Like my one, I also have done the braces, and after some time, I didn't wear the retainer. It start to relax. I have start to have a gap here, yeah, near my premolar, start to have a small gap 1 to 2 mm. So after the I think my treatment done already 4 or 5 years. Now have the gap is slightly bigger.
Because of the extraction of the first premolar, right? Bend over for the small arch.
Ask her.
Actually, the relapse gaps because of we are not wearing it. But the thing is, you say that the group A and the group B, right? Group A, the doctors told that to wear the full time because of the extraction of the teeth. You need to pull the teeth together to close the gap. For that, we have to wear for the full time.
Actually, not like that. Actually, even most of the cases for they're having crowded teeth, they will do the extraction. It's very common. But after the treatment, you need to wear the full time. Some people say because they don't want to relapse. Because after you will start to eat the heavy food, like you will start to chew chicken. So as time goes, the force is applying over your tooth. So your posterior, the third molar, because you won't have the third molar or premolar already. So the gap, it will start to push away your tooth slowly. So that's where the gap is take place. And sometimes you will use to eat your something like ice cream. Sebab lepas kita punya premolar semua cabut semua, treatment dah habis, kita akan makan makanan yang berat. Kita akan makan chicken, mutton, all that. So it start to slowly move. Sebab dekat belakang ada gap. Kita punya retromolar pad semua ada gap sikit, so dia akan push slowly. Kita tak perasan. Lepas sometime macam saya, lepas 2 tahun baru perasan start to have small gap. Sebab kita banyak guna makan.
Sebab masa kat lecture dekat ini, doktor notis tu cakap gigi kita bergerak berkelas treatment braces tu dia tak ada kena-kena dengan retainer. Kita pakai, kita tak pakai pun dia gap kalau ada gap tak ada kena-kena dengan sebab kita retainer tu. Macam mana?
Actually retainer itu untuk hold the arch.
Kalau ada gigi dalam gigi sebelah ni pakai braces tu, pakai tu macam ni. Kalau dia tak pakai retainer, gigi berak balik. Tapi dia tak ada kena-mengena yang kita tak pakai retainer tu.
Ya, memang kita tak kena. Hello.
Otomatis tu bagi tahu gigi bergerak. Kalau kita tak pakai retainer, dia tak ada kena-mengena sebab kita tak pakai itu.
Bergerak sebab apa?
Ya, betul, dia tak kena mengena dengan retainer. Retainer punya function hanya untuk Kafiza, Puan Hafiza. Actually memang betul, retainer tu tak ada kena mengena dengan pergerakan gigi. Retainer tu function dia just untuk maintain the position of the gigi daripada relapse. Tanpa retainer tu, bila kita keluar macam kita makan, baru dia start akan gerak. Sebab kita bone soft, dan tisu dekat sini soft bone, bukan hard bone. So dia akan slowly gerak lepas kita makan. Macam thumb sucking, kita bila thumb sucking, it's not in one day dia akan jadi procline. Patient tak akan jadi procline. As time goes, kita letak jari kan budak-budak suka letak jari thumb sucking kan. So dia akan slowly gerak. After 6 months, 1 month, then patient start to have a proclination. Understand tak? Sebab tu kita pakai untuk thumb sucking, kita pakai heavy breaker supaya patient tu tak letak tangan. So same thing, kalau tak pakai retainer, as time goes, gigi dia akan start bergerak. Sebab dia akan relapse, dia akan sosok. Memang dia tak kena mengena, tapi dia punya support dia banyak important untuk maintain dia punya alignment semua. Okay. Encik Mat, tanya soalan ke?
Saya mungkin hello, saya nak tanya, tak tahulah soalan ni mungkin soalan lain. Kalau sebelum kita mula pakai retainer tu, kalau untuk kanak-kanak berapa yang sesuai untuk pakai braces sebelum dia start pakai retainer?
Braces
Pada usia berapa? Sebelum dia mula pakai retainer.
Actually yang ni basically straightforward, more on the clinical part. Tapi according to saya understanding, selalunya doktor akan check dulu memang dia perlukan interceptive treatment tak. Kalau interceptive treatment, kadang budak 5-6 tahun mereka akan start guna twin block untuk buat early treatment, myofunctional appliance, mereka kata myofunctional appliance, twin block untuk buat interceptive treatment. Bukan, dia tak akan pakai braces, dia akan guna interceptive treatment. Yang budak 5-6 tahun dia akan buat interceptive treatment. Tapi dia tak akan pakai braces.
Removable lah.
Just removable, dia akan guna twin block untuk gerakkan gigi atau myofunctional appliance. Macam bioblock. Bioblock itu dikira salah satu sebagai myofunctional appliance, twin block, Frankel appliance macam tu. Tapi yang braces saya lebih umur 12 tahun ke atas. Sebab dia permanent teeth, dia akan start ada permanent teeth baru 12 tahun ke atas.
Mungkin sikit pandangan saya pun ada macam ni. Perbedaan tadi, kenapa tak daripada braces kan? Berapa usia berapa? Normally baru umur 12 tahun. Okey, tapi bawah 12 tahun, adakah tak boleh buat rawatan auto? Boleh. Sebab rawatan auto daripada awal lebih baik. Nak compare nak umur dah 20 tahun orang buat, sebenarnya braces ialah orang kata last choice lah untuk kita buat rawatan. Tapi kalau mana operasi tersebut boleh dilawan ketika kanak-kanak lagi, that's why kita ada seperti pre-block, bioblock, URE yang kita pakai. So kat situ membantu untuk eruption, untuk penekan gigi. Dan akhirnya pada umur 12 tahun eruption tersebut dah cantik dah. Dan sekiranya diperlukan braces, minimum pengerakan sahaja diperlukan. Itu yang sepatutnya biasalah kita lakukan.
Baik.
Terima kasih Encik Najib sebab kongsikan pengalaman Encik sebagai juruteknologi pergigian dan ortodontik. Saya rasa semua I have answered everyone question, right? Any questions? Dah tanya? Ada kan? Okay. So how many hours is based on clinician also. It's not right wrong answers. So based on the journal, you can wear night time only, or you want to wear full time also can, but there's not much difference according to their studies. Later maybe I will share all the journals, the reference. Maybe if you all have doubt that something what I say is not accepted, you can refer back to the journal also. I can suggest that journal. So next, quiz 2. So after finish quiz 2, we will take a short break. Okay, maybe we can have a thing. So once again, but this one is one question only. Hello. Oh, let's go. Puan Syubal kata let's go. Yang kain nak asyik love je, mini love. Tengok yang kain boleh jadi juara bertahan tak? Syam handsome upgrade je daripada Syam hebat. Encik Hisham hebat.
You can change baju, man. Change lah. Saya tak nak jadi botak. Aduh. Tapi lelaki je memang punya. I nak besar. Tak payah tadi. On reason lah.
Semua dah 12. Lagi
Bukan itu.
Okay, peace.
Masih kita masak dia mau.
1, 2, 3. Kai cannot see you lah. Okay, 1, 2, 3. Okay. A few more. Got me lah. Samira, Sarah, Syubha, Shini, Prahfiza, Jamini, Jalipi. Who is no risk? Oh, Kak no risk. That's what I was thinking. Who's no risk? Okay, Major.
Attempt, is it? Or start over?
Resume attempt.
Okay.
Yes. One question only. Okay, Start, 1, 2, 3, go. Read question properly. Higher, better, high, easy to customize, all the above. Jawab. Wih, tiba-tiba Yong Kai datang. Oh, juara bertahan Siti Dalila. Okey, Yong Kai dah kena tendang keluar dah. Puan Syuta, Puan Nat.
Cepat je penting.
Okay, kita dah settle modul kedua, and the last module which will be taken more longer hours, and because it's involving wire bending, it's involving about the protocol, the treatment plan, everything. So we can have a short break, toilet break or anything for 20 minutes. Okay, right? So we come back around 10:45.
或者你这个 game 是什么
Quiz 啊，这个 quizzes。可能ada dah. Okay, kita akan start balik kita punya session ketiga modul 3. Semua dah makan kan? Okay, how is the first half? Okay, enjoy. Good, understand. Okay, boleh lulus exam. Puan Fiza. Hah? Pecah tadi. Oh, sebab dia ni top rank. Sebab dia tadi dah achieve dia target. So kalau macam tu, buat lagi satu nanti tiup. Okay, module 3 adalah so dia berkaitan dengan design and fabricate Hawley retainer. As just now I say, the first module 1 module 2 is the foundation for our fabrication. That's what differentiates a qualified dental technologies with our unqualified dental technologies. As long you know the foundation, the basic, then you will have a confidence to do what you're doing. If not, you are doing blindfolded, you are blindly doing, okay, the doctor asked me to do the wire bending, I just bend. You can be bent, but you don't know the purpose. But now at least you know what is the purpose for you to bend the Hawley retainer. What is the function, what is the advantage, what is the disadvantage, how it will relapse, how it will usage hours. Because sometimes even young dentists, they didn't know. After they grad, they didn't know what's the function of Hawley retainer, how to fabricate. Because this really happened. Even now, because a lot of young dentists, they even come and message me, Mr. Diba, how to design it? Can you help me to design? I say, doctor, this is your things, your task to design. Then he or she will say, oh, actually this is my first time. Can you help me or guide me to design? So then only I will step in, even though it's not our part as a dental technologist. Based on what is the knowledge, the experience we have, I share, okay, doctor, this what's the treatment? Usually I ask, what's your treatment plan? What's the purpose you want to do this? Then they will explain, oh, Mr. Diva, I want actually to retract the teeth. I want to move closer, I want to close the gap, I want to close the midline diastema. Then I will suggest, okay, you can go for Hawley retainer or you can go for split labial bow Hawley retainer. Then I said, is it will function? Yeah, it can be function. And sometimes even just now got one doctor message me, can I send you a 3D scan model for TPA? I say usually I won't prefer 3D scan for the TPA and lingual arch because you cannot solder. So he asked how to take impression. I say you take the alginate, you fix the molar band. Because some lab they will ask, they will do the molar band externally. But usually it's best is you use your molar band fixed inside the patient mouth, then take the impression. So I tell the doctor, you take a precise molar band fixed inside the patient mouth, then you use the alginate to take impression. Because sometimes they are very young, they just want to, they are interested in orthodontic. So based on experience you can do it, but actually it's not our job. But just you can guide this thing because it's all the clinician part. But it's not a waste. It's a good, at least people know, the doctor will know that you are still a knowledgeable person to guide. That can be trusted. So we go for module 3. Module 3 is the first we want to understand for the Hawley retainer. Even though this is not a completely Hawley retainer, actually this has some kind of modification. But it's very nice, so that's why I adapted this. For the primary component we need to understand is the Hawley retainer is a 3 component. It's the most important. Anyone asks, you should understand this. First is the base plate. This is the major connector which is holding all the wire components. So base plate is the most important part in this. Could be called as a major connector which involving the Adam clasp. Adam clasp usually we set in the 6 for Hawley retainer and labial bow, or in some overseas they call it as arch wire. And all these Adam clasp, labial bow, they will use a 0.7 wire, 0.7 mm stainless steel wire. And actually this is the arrow clasp, like a ball and clasp. We call it an arrow clasp, but actually it's not under the component of Hawley retainer. It's just an advance for add-on to the encourage purpose for retention. And for Hawley retainer, they got 2 purpose. It's not like S6. S6 is just a one purpose only. It's just basically to maintain your arch, maintain your tooth from misalignment or malocclusion. While Hawley retainer have 2 functions, which is for retention purpose and also for the activation purpose. So retention for retentive purpose is just for holding the teeth. For some cases where I say just not at the beginning, if the patient after the treatment debond cases, after debond they have some mild gap, a very mild gap at the 3 to 3 in the between the canine or lateral incisor or central incisor, there's very mild gap. So what they do is they suggest this kind of Hawley retainer. So the labial bow will be act as an active component. The labial bow have a good function is it can be as a retentive or and also can be an activation component. While Adam clasp is solely for retentive purpose. It's just to hold the base plate, and when it fits inside the patient mouth, it's not falling off. So it's just for the retentive, the Adam. While the labial bow, you always need to remember it's a 2 function. one as a retentive, one as an active. So when if the doctor want to close the gap, then they will activate it. Activate the U-loop, which I will tell later part. But all this is a clinical. But at least we need to have a basic understanding on this. Then we know, okay, why the doctor want a U-loop, why they didn't never straight, don't want the U-loop, why didn't bend the wire straight like an arch and go into the care interdental. Why they want the U-loop? Because the U-loop is the part where they will activate to close the gap. They will trim off this part. So when they trim off that, they will have gap, they can activate the U-loop, they can pull back and retract the teeth. And basically, before I go to the next thing, it's most important, which I think most of the dental school never teach, which I learned from the aligner cases, from the treatment plan, where it's very important for us to know these few components, few words. This is what we call as a treatment protocol or planning protocol. If you are doing a digital cases like Invisalign, like what I think Encik Rosli was very interested, if you want to go for do the orthodontic movement of teeth, then all these terms is very important. The intrusion, extrusion. That's why I say, as an orthodontic dental technologist, you need to know the treatment plan, which teeth you want to move, which teeth you want to angulate, which teeth you want to straighten it, which teeth you want to retract. So the intrusion, extrusion is where if the force just say this is the central incisor, reverse. If you want to extrude the teeth, then they will call extrude. So sometimes the patient crown is very short, they want to extrude. So, or intrude inside. So this is called intrusion and extrusion. The proclination and retroclination is, sometimes the patient will have an overjet. If you want to procline, they will procline, or they want to retrocline. So that's what, actually Hawley retainer have one of the function. If you position properly the arch wire, it can act as a proclination or as a retroclination also. You can procline the teeth or you can retrocline the teeth. And the rotation. Just now you can see at the ideal requirement, one of the ideal requirement of the Hawley retainer is to prevent the rotation of the tooth, is to maintain the position. Because after sometimes the teeth will tend to rotate. Even when you will wrongly bend the wire, it tend to, from the making the teeth to distalize and mesialize, it will become the rotation. For finger spring, you all know about finger spring, right? Okay, the finger spring actually it touch 1/3 of the canine only. But some technicians in the private, they don't understand the concept, they will hug the teeth like a C-club like that. So when they activate the canine from supposed to become mesialization to close the gap, it will rotate. So that's why the length of the activation wire also must be very careful. Just for the nice, you bend nicely like a C-club, instead of mesialization, it will become rotation. And another thing is mesialization or distalization. And angulation. Angulation is your teeth crown, whether one angulate like this. The root. The root slightly usually will go for facing the distal, and the crown usually will face mesial a bit. You can see this when you set up the teeth, you see the central incisor, it will be slightly to mesial, and the canine, the root will be slightly to the distal. That's why we sang it. It's not straight. We won't place the teeth like this straight. So that's the angulation, and expansion is on the arch. But for Hawley, we don't use for expansion. But this screw I show just for can use as expansion for the arch. It's just for extra this protocol. And I think it's mesialization and distalization. And certain component like orthodontic, like buccal canine retractor, all that is used for the mesialization, distalization, and like finger spring for mesialization for close the gap, and jet spring to procline the teeth of the lateral, forward, T-spring. So it's like all this indirectly involved, the proclination, the retroclination, rotation, angulation is involved in each of the component. This one basically for all the orthodontic appliance. But for Hawley retainer, we use basically for close the retroclination, to close the gap. Whenever they have some gap in between, like midline diastema, then we can use that one.
Actually, in Penang, we were exposed with this.
Oh, exposed to this.
All this, yeah.
But over the time, I never heard people start to use this as a dental technologies.
Because I remember I had all these in Penang notes. In notebooks, we had all these, the angulation, rotation, I remember intrusion, exclusion, yeah.
That's why this is very important for the orthodontic planning protocol. If you do inverse line, you're doing the alignment, aligner, then this is very important for the treatment. So the doctor said, actually I want to align the, angulate the canine a bit. I want to do a sequential movement. I want to do a lateral movement. Then we need to understand which one, or interval movement. So then we will know like which movement you want to plan. And all this movement, like angulation, certain teeth, like for canine you only can do 1 degree. Like rotation you only can do per tooth 4 degree per set. Like proclination you can do up to 2 degree. Intrusion, extrusion you can do 0.15 mm. Usually I won't do 0. I go for 0.10 mm. So all this more on the clinical, but it's very good for you to understand how much the movement will move on. In case in future you want to go for the inverse line planning, don't want to go for analog. Because analog is not much important, this one. Because we just do the wire bending, like that. But if you go for digital, this is compulsory. If you've got 40 set of aligner like this, which means until complete treatment, the patient need to wear 40 set. You need to fix, okay, per set, how many degree of angulation for canine, how many mm of mesialization. You cannot give a lot of force. Actually 0.20 is considered high. Some doctors they give 0.20 because they want to finish the treatment earlier. So the patient will be very happy. Oh, supposed to be I go to another clinic, they say 2 years of the treatment, but you finish in 1 year. But actually in 1 year he suffer a lot of pain sometimes.
Unhealthy is such a good.
Yeah, because he's pushing more than. So we want to move very fast. So he will activate more, use the aligner more stronger force. So the patient having more pain.
And I think it will damage the root also.
Sometimes it will damage the bone, become very soft. That's why we need to have a predictable movement. We call it as a predictable movement. So even the appliance, the orthodontist or clinician, they will do a predictable movement according to the treatment plan. How much per week? That's why they do a review. You come after 1 week, you come after 1 month. So after 1 month, they move ready, then only they go for next step. That's why they need to move the teeth slowly, like that. So next.
Casing setup tu prediction ni kan? Betul.
Casing setup dia macam lepas complete treatment what you achieve.
Oh,
the final thing.
Oh, yang tu macam predicted juga.
Predictable kan? Juga. So yang casing setup is everyone know about casing setup?
Casing setup. I've seen before.
Casing setup is usually they give a malocclusion teeth. So the doctor, last time we don't have a digital system. So they go for the casing setup. So what will they achieve? So they cut all the teeth like a crown like that. They set up with the wax. So I put back to just imagine what is the final treatment they achieve. But now all since they go for digitalized, they just use this one treatment protocol. They use the software. We show the patient, okay, this is the final treatment. Your 40 set, your first set, your teeth like this initially. Second set, you like this. After 10 set, your movement like this already. We can show each one set like that. So the patient can know already. Oh, every set there is this kind of movement going on.
So can see until the end of it.
Can see until the end of the treatment.
Are they still doing it now?
Yeah, image line is like that.
So they change the
whole thing method. Like analog system, you only know the before and the end. Like inverse line treatment plan, you can see every each step. If 40 step, one set you wear for 10 days. 40 set means 400 days. So almost like 1 year plus. So in the 1 year plus, you will know each week how much is your movement. The patient can see that. We will always do a simulation video to show the patient your first set like this, second set like this, third set like this until the 40 set. So the patient will know whole set. And another thing is the patient's compliance is very important. That's the most important for inverse line. If they don't comply, then you cannot achieve the final result, the 40 set we cannot achieve. So halfway there we see, oh, my teeth not moving. Then we ask why, did you wear? Oh, I didn't wear for 1 week. And then it will relapse. So basically, before our wire bending, we want to show this is the fabrication cycle. Usually, the first is to start from this first, where every time before in the orthodontic, in the wire bending is very important is, in designing is, you do a marking for design. Like us, like myself, I will do the marking first. So this is Adam, I will mark where I want my Adam, my Adam is placed, how long is my labial bow, where is my U-loop, I will draw first. This will be an imaginary guideline. So with this, because we cannot straight away bend, even you how long pro expert, even like myself is 10 years, I didn't change it, we still doing a marking, we still mark, because that's what will guiding you. You need the guidance. So the guidance will lead you for the ending of the completion of your fabrication. After your marking, then you start to bend the Adam, labial bow to Adam. So this is the U-loop from the lateral view and the final product. Okay, so this is what we will do today. We will do until all the wire bending. We don't do until the fabrication, or we won't do until the acrylization, because we need to go something like this. It takes a lot of time. So we will do until all this, because the most important is the wire bending should be correct, because everyone know about the how to do the acrylic. Acrylic is the most easy, one of the easiest part. You just pour the resin enough. But the complicated part is the wire bending technique, the marking, what is the height, what is the each part of component name. All that is very important. So the next we will do is activity is the wire bending. Okay, we will provide. I think everyone we have the provide the Adam, plier, things, everything. I will show a live demo. Then you all can bend. We need to bend 2 Adam and also the labial bow. First we start with the Adam, 2 Adam, the first part. Once I show you a live hands-on demo, you can follow or you can watch first. After watch, I will go through all walk around and see how you all bend. If you don't understand, can ask me. I will guide you on the spot. And for Adam, okay, this is the Adam class. Okay, you can see got a few from the lateral view. Second thing is this I take from the digital. Use the STL file. If you have the STL file, once you scan, you can use that file. You can print out the model like this. Actually, you can do on the printed model also nowadays. But in our region in Malaysia, we don't have the separator. Actually, for digital printed, like we have the Vaseline, we have the Colmosil, right? We have another name, it's called a separator, which is separator for acrylic. You will apply like a Colmosil, then you bend, you just pour the resin on top. You can easily bring out. But in Malaysia, we try to find the supplier they don't want to bring in because the demand is not there yet. So what?
You cannot pour on the digital model, so we stick together.
You stick together because the before there is the acrylic resin, and this one also considered as a resin, so it will stick without the separator. If you bond together, you can take it out. But in case in Malaysia, if in case in future you get the separator, then we can just 3D print it. Because now most of the lab they accept the printed model in Malaysia also. The problem is what they do is after they printed, they take the alginate to duplicate back, then they bend in the stone model, then only they fabricate the Hawley retainer. So it's like double job.
So it's better to pour stone.
Yeah, it's better to pour stone because we cannot get the separator in Malaysia because the demand is not much. So in case the supply want to bring in, there must be a lot of demand. People need to ask because they need to register to the MDA, Malaysian Dental Association. So they need to pay certain amount of fees. The cost was very high. So when the cost is very high and no demand, so what's the purpose? I want to register to MDA to bring in this material. That's why in Malaysia, a lot of material we cannot get ready. Even the color acrylic, we was requesting, I think I personally request to the supplier quite some time. They say they cannot bring in because say only 1 or 2 person is asking. I bring in, I need to register to the MDA and it's cost me a lot. So what for just 1 or 2 acrylic, the color acrylic, I need to pay so much. So they don't want to bring in. Last time they got bring in. Now I think the MDA was very strict. They control the thing. That's why we want to get the latest technology is very difficult. And if in case some of you, I know some of you have used the digital scan before. If you want to view, you can download the XOCAD. It's a free software. Just hold on, huh? Okay, it's a free software. You just go to XOCAD viewer, you install, you can download, then you can view. So from here, you get a scan model, you can view. You can do the planning like this also. So actually this is the free software by XOCAD. Because XOCAD got a lot, you can do the crown, bridge, everything. But for viewer, you can just download the STL file, you can just view and design. So, for as long you all understand the component, the primary component for the Hawley retainer, right?
Yes.
What's the name?
Primary components, and also the major connector.
The base plate.
Yeah, base plate.
Okay, so 3. So for Adam, they also have a name for each part. So, so if this is the Adam, right? This is we call as bridge. This part we call as a arrowhead. This is shoulder, and the behind one is a tag. Comel lah. Who comel? The drawing comel or me comel? Both comel lah. Okay, so in case any doctor asks, device not fitting, then you can ask whether the you have activated. It's very loose. So the doctor usually will activate this arrow part to they make it tighten or lose it. If very tight, they lose it. If very loose, then they will tighten it. So that this is the activation part for the retentive. So you ask the bridge, the length of the bridge. The length of the bridge should not, you can be the highest cast got 2, right? Mesial cast and distal cast. So this is the highest cast. So it should be in between like that. Or slightly longer, no, shouldn't be a problem. But don't go beyond the interdental. It's like you are disturbing your neighbor. No one like disturbing your neighbor, right? Or neighbor disturbing you. Can you like? I know you like lah. You like, right? Just joking. So remember that this is the bridge, what I draw. This is the arrowhead. This is the shoulder and the tag. The tag will be placed here. So the tag will be here. You can see, right? So the tag will be follow the interdental. Okay? So understand. And the bridge, and usually we say 45 degrees from the buckle. The Adam must be fabricated, designed 45 degrees, which means if this is the buckle, right? Can see? Okay. If this is the buckle, right? The component should be like something like this. It will be slightly 45 degrees. If buckle is 90 degrees, the arrowhead and the bridge should be 45 degrees, slightly angulated. Okay, and the arrowhead should be sit on the cervical. Some of them they say pocket. It should be engaged into the cervical. There's a place to sit. Yeah, usually what we do is we will take the lacron, we will carve a little bit, but don't be so deep. We carve a little bit as a place for the pocket. Yes, just scratch a little bit with the lacron. Later I will show you all. Okay, so now I will do the demo for the Adam class first. You also watch, and if you do not understand, you can question. Okay? Yeah. First I will draw to divide a certain part. Okay, right.
The bridge from the crown, how far is it?
Usually I will do until half. From the you can see from the neighbor teeth, there's a gap for interdental. The shoulder go in, right? It should be same height.
The interproximal area.
Yeah, the interproximal area. That's
it has to be.
Yeah, just cross like that.
So that is the height of the
yeah.
bridge.
Usually what I personally I will do is I will do maximum is half of the crown of the molar, because we always need to think in our mind there's always a lower model. So when we occlude the patient biting, patient occluding like this, if the patient having upper and lower Hawley, right? So the patient when having upper and lower Hawley, okay, it should not bite to the lower, because if your Adam class is very high, then it will occlude with the bridge, it will disturb, it will become open bite. So the doctor sometimes need to adjust. Because when adjust, sometimes you adjust a few times, sometimes Adam tend to break.
The bridge is a bit difficult to adjust once it's high, right?
Yeah, that's why the bridge, usually the height of the Adam, I do until half only, half of the crown.
Half of the crown, the bridge.
Yeah, maximum 2/3 of the crown. Don't go, if the crown is like this is half. Maximum you can go until here only. Don't go until some of them they go until this height. If they go until this height, when they occlude the lower, they tend to engage yeah. So the patient cannot close the mouth. So the doctor need to adjust. In case they adjust, then it tend to break, because the molecule inside the wire is
Easy to fracture, especially at the
at the head, because there's actuation part. So you need to be very careful. So I will show you all the wire bending, how to do the marking. First I will do the marking, then I come out. Just give me a moment. Cek.
Ini di mana?
Ini daripada TV kena pergi. Oh, TV kena pergi sini.
Bukan speaker ke sebab?
Speaker tak boleh guna je itu. Tak boleh guna. Tak ada problem kena scanner. Dan itu ada problem.
So kat sini je lah boleh?
So yang ini tadi dia connect. Yang ini dengan sini. Ini ikut.
Itu mana?
Yang ini dengan ni okey.
Ikut sini lah.
Tadi mana satu Super. Kena panggil raja kot.
Ya. Ada output ni.
Itu dia kata, sebab raja kata kena buat manually lah, asingkan sebab dia punya apa projector tak boleh detect. So dia connectkan ini dengan ini supaya dia boleh connect dekat projector.
Sekarang ni Ibu nak bawa ni ke situ ke?
Tak,
Ni
ni projector sini.
projector ni ke sana?
Kat sini.
Kat sini. Sini mana dia punya ni? Ni ya.
Ini.
Kosong kan?
Ini kosong. Off jap nakam itu record lah. Saya off. Slideshow will be there. Okay. Hello. Everyone have the pencil? Yes. Semua ada pencil kan? Ada sesiapa yang tak ada pencil? Okay, for Adam class, first kita akan buat marking. So this is the maximum, the distal part, right? Maximum. So don't go beyond your bridge. The length of your bridge shouldn't go beyond this, even your arrowhead. Second thing, I will mark the highest distal cast. This is the highest cast, right? Can see? This is the highest cast, followed by the mesial cast. And the height of the bridge is from the interdental don't go more than half. Because as I said just now, if you go beyond the half, then it will engage and it will be disturbing your opposite, the adjacent teeth, which is your lower, after you fabricate. So it's very difficult for clinician to adjust. In case the edges sometimes break, then they need to come back for repair because it cannot be adjusted so many times. Usually it will break at the head. Can see? Okay, after you mark, then I will provide everyone with the wire. Maybe after I bend, I will give you a wire, your bend, then I will come to see how you bend. I will guide you the step and also the plier holding technique. Basically, I will use Adam plier for the whole thing. I won't use spring former at all. Okay, everyone can see, right? So first, you take a short wire of 0.7 mm of wire, place use the wire, decide which one is the middle of the wire, then place at the marking place. Just now we already marked the highest cast, right? The mesial cast and distal cast. So you mark the bridge. The first one is the bridge. So this is the bridge. This is the bridge. Can everyone see? Yes. See, right? The two dot, the marking is actually the length of the bridge. So the bridge should not go too so lengthy until the interproximal, because it's so lengthy until interproximal, it will be go later when you bend the arrowhead, it will be disturbing to the neighbor tooth. Yes, Encik Mat.
Tak apa
Usually kita tengok gigi yang sebelah dari sini kan, dia nampak tak dia straight macam ni. So you bend wire pun cuba bend ikut dia punya arch, the arch curve macam ni. So sebab bila kamu bend dia punya labial bow, dia akan macam intercept dengan you punya Adam. In case kita tak buat Hawley labial bow normal, kita buat Hawley labial bow modify yang soldered. So in case kamu follow gigi sini, kau sengit, sini cantik pula, sini cantik, tapi bila connect dekat sini tak boleh solder pula, kena adjust banyak. So kalau sini sama, dia punya curvature sama, so bila kamu connect dia punya soldered labial bow, senang sikit. So follow the arch.
Pada lateral view yang dia agak shift.
Tapi make sure kita punya arrowhead dia memang duduk dekat dengan dia punya cervical. It's very important.
Kalau dia shift ke shift, maksudnya dari lateral view kepada tepi. Kalau dia so bridge itu kan akan
bridge Encik kena tengok dia punya sebelah punya gigi kan, dia punya interproximal berapa height. Sebab kita punya shoulder akan ikut interproximal. So kadang-kadang kita akan shortkan one side. Usually mesial dia akan lebih tinggi sikit, distal akan short sikit kadang-kadang. Sebab kita akan nampakkan the curve of the speed compensating curve. So when it go to compensating curve, dia punya mesial kadang-kadang dia akan tinggi sikit, distal side dia akan short. So kadang-kadang kita punya distal punya yang vertical height tu dia akan pendek sikit. So mesial punya height kadang-kadang tinggi. So kita kena tengok kat crown size dia. So the crown size also very important for you to see. If the crown size is one side short, one side is height, then you need to follow the height also. You need to compensate. So you need to compensate. Try to balance both sides. Usually I try to balance both sides the same height. Except it's really very obvious the distal side is very short, then I have to bend slightly shorter on the distal. So you done like this, the marking, then I will start to use the Adam plier. Just hold the line before. Seriously, macam warna lampu tahu tak? Lampu dia, lampu ni. Kita tahu tak lampu dia macam mana? Oh, tebal sebab tak nampak. Now you all can see, right? More clear? Okay, so when you bend, we bend just your marking line, right? Just before the marking line, bend. Okay, can see now? Okay. By me, I will do bridge slightly longer than the highest cusp. Okay, hold here, then bring it down, perpendicular. Can see? Can see, right? So next, I will see the length, okay or not. Can see? I put in reverse, not like this. Because like this, you cannot just do the judgment how much is your height of the arrowhead. But just now you can see for this model, the mesial side slightly higher compared to distal because the interdental is slightly shorter. So I place back in reverse position. You can see on the cervical is touching. Then I will mark again. Because you can see just now we already marked, right, the pencil, the same height and also the another part. So I already marked according to the imaginary line. Just now with the pencil we already draw the imaginary line, right? The imaginary line is your guidance. So now you already mark. So can see? Can see the marking line, right? Everyone, it's clear? Clear? So this part is a mesial, this part is a distal. So don't confuse when you reverse back. Suddenly you reverse to distal part pula. Once again, I hold the place before the marking line. Before the marking line, then I bend towards outwards. The first wire you bend towards your friend, not towards you. Okay. Now the distal is toward myself. Make sure you hold the plier very tight. If not, the wire will start to flew. Okay. So once you're done, you can see, right?
Saya akan tertarik cincin. Dia punya reflection cahaya.
Saya kena tanggalkan cincin ke? Jadi saya tanggalkan lah. Okay, can see, right? Now clear. So the holding position of your plier, okay, go in between like this. This is a technique. As I say, everyone say Adam is the most difficult component to bend. Every time students say very difficult to bend this Adam. Actually, for Adam, it's the only component with a technique. Others all you have to estimate. You need to do a judgment how much you need to bend, how long is that. For this Adam, you have a technique. You place your plier like this. Why you place like this? Because this part will be holding by here. So when you bend this one, it won't move. In case you do like this, see, can see, right? That's why we need to lock it. We put in between the Adam plier like this. The first one bend towards you like this. You see, right? Then bend up. So you can see. Can see the arrowhead? Can see that? The second one, again, you just block it from the side way. Okay, just like this, from side, go in. And you should hold the angle there, near the tip of the Adam plier. If you hold two in like this, the arrowhead will become very big. So that's the most common mistake. Why they say, oh, why my Adam is not tak jadilah, besar sangat dah dia punya arrowhead, because they hold it too in. You need to use your Adam tip, the tip here, to hold over here. Hold at the tip. The first one just now, you bend towards you. The second one, you facing towards your friend. See, I bend. Second one, this will be facing outwards. Just now facing inwards. Initial. The second one, I facing outwards. For the first arrowhead, I recall back. The first arrowhead, when I bend like this. So I bend towards me and go up. The second one, I put on the opposite way. I bend outwards, which is facing my friend. Then bring it up. Okay. Then your second arrowhead also happen. Can you see clearly? Then I will bend once again later to show you a more clearer picture. If not, when you all do the hands-on session time, I will walk along to guide you all one by one also. So everyone can ask questions, everyone can know the technique of holding the plier, which part of plier you need to hold, in which position you need to bend the wire. Then every time once you bend, always check your model on your model. Just now I forget to scratch the cervical part. Because this case you can see the cervical. I bend the cervical there here. And see, this is the cervical. I scratch it. I scratch the cervical. Because this is where your Adam will be sitting. So I adjust the arrowhead by holding these two parts. If this is the arrowhead, you want to adjust, you use your Adam plier, hold together. Hold together, adjust to open the leg a bit. Hold again, adjust. So now you can see, right? Actually very easy, right? A few minutes can bend again.
Very easy to see.
Okay, then you see the height, the marking line I already marked, right? So you cannot see it because it's already covered by my wire. Because it's same height with the marking. Okay? Can got it? Put here. Then I will bend the shoulder. The shoulder height usually what we will do is, it's very difficult to estimate. You need to put the plier together, holding the arrowhead. I hold the arrowhead, can see that? The two arrowhead I hold together. Can see? Once again I show, this the arrowhead, then I will hold it together. The first one I use my finger to push towards my friend. See? Then why I want to push towards? In case I do directly, the wire will be like move away. So I lock it towards here. Then I push back. Where I take, you see. You see, right? So I place back here. So I will do some adjustment, the shoulder to follow the interproximal. Can see the arrowhead sitting in the cervical. Then this one is touching near the interproximal, the shoulder. Then I will adjust the shoulder, follow the curvature of the interdental. You need to follow this line. Okay, it should sit as much as possible on the interproximal. Because if your shoulder is high, then the patient, the lower one to bite, it will bite on the wire. So the patient will have difficulties. So I bring it down, I hold it, I bring it down. Then I will mark again the tag. So you can see it's follow, right? You can see that? It's follow. Then I will mark for the tag. So from here, I slowly bend. I bend like a curve. Don't bend sharp, because in orthodontic, we don't prefer a sharp angle. Even the arrowhead should not be sharp, because when it's sharp, if we apply a kind of force, the patient start to pain, because the sharp force is the force pain will be high. So we try to do all like a curve like this. So I adjust towards up because too lengthy. I bend some more, go down. Then I will bend the tag. The tag you can customize whether you want to do like zigzag, you want to do L shape, or you want to do love shape. You can customize. You want to be very creative. You want to do like a circle, a coin. You want to do love. You want to do a box. You want to do L. You want to do facing the palette. It's up to your. It's up to your creativity. Once I bend like a zigzag, then I cut the excess. The excess has been cut. So this part I settle. Can see?
Berapa rapat bridge tu dengan buckle ni?
Huh?
Bridge dengan buckle ni berapa rapat?
Bridge tu dia tak perlu rapat. Actually that's why just now saya cakap dia kena 45 degrees. Saya cuba lukiskan. In case in case ini adalah crown. This the buckle kan? Okay, this the buckle part. Dia punya angle 45 degrees. So dia akan menjadi macam ni. So buckle dia ke sini. Ni buckle, ini dia punya komponen. Boleh faham? So bila ni buckle punya komponen, ni arrowhead. Dia kena angulate 45 degree. Dia tak boleh rapat dengan buckle. So 45 degree bila doktor clinician in case dia nak activate, dia akan closekan sikit. So dia akan rapatkan dengan buckle. So dia akan activatekan dia punya arrowhead.
Tapi kalau 45 degree setahu saya kan macam ni lah. Ni petak ni. Petak 45 degree macam ni. So dia akan lagi turun lagi tau kalau ikut angle.
Dia akan macam ni. Dari sini macam ni. Dia akan jauh sikit daripada buckle. Dia takkan contact. Okey, saya rasa ada contoh. Okey. Nampak dia dari sini dia akan ada 45 degrees, tak touch. Dia tak jarak. Dia as long dia 45 degrees, dia punya arrowhead macam tu. Bila 45 degrees dia memang ada automatik ada jarak. Sebab arrowhead itu akan membagikan dia punya jarak daripada buckle kepada 45 degrees. Sebab dia punya arrowhead macam ni kan. Dia arrowhead itu akan yang menjadikan 45 degrees. Buckle 45 degrees dia takkan touch dekat palette.
Tapi yang faham Rosli cakap tadi 45 kan kalau 90 kan. So 45 tu dia separuh ni, dia akan lagi condong.
Ya, dia akan condong. So nanti doktor akan activatekan dia.
Yang ni dah lepas activate tadi maksudnya. Abang Rosli cakap tadi sebab dia kalau 45 dia kena condong lagi.
Yang dia akan condong lagi, dia akan activate nanti.
Betul lah.
Looking at the real 45 degrees.
Oh, macam 45 degrees. Dia actually in the study scientifically dia 45 degrees. Tapi doktor dia akan activate, dia akan closekan balik dan itu. Dia takkan rapat. And good question. Terima kasih Encik Rosli.
Because he said 90 degrees specially is that from the 90 degrees we divide by 2, he said it's like 2 months.
Yeah, I can understand. Terima kasih Encik Rosli dan Kak Puan Ain. Puan Ain lah, Puan Norish. Terima kasih Puan Norish. Okay. So, kamu akan dapat tag once like this. Yang saya buat first tag tu zigzag. depan. Can see he's sitting on the cervical. Then I will do a shoulder for the distal part. It's same again, the same principle. Be holding the arrowhead together like this. Then the first one just now we are facing your friend. The second one facing myself. You can see that is facing myself. Then I will follow this. The plier, the nampak tak gigi dia plier ni? I just forward this. Align with this one. Can see that? Ini mulut, ini Adam plier kan? So ikut straight je. Okay? Lepas tu put back on your model. Adjust the height. Okay, so it's still high, so I will reduce the height. Come on. Okay, you can see now? So now I bend the tag. I will mark this line. Again, I will bend the tag on the distal part. The other part, I don't do a zigzag, I just do a L. I just cut off the excess. So the tag is still a bit high from the palette because there must be a small 0.5 mm to 1 mm of space for the acrylic to flow in. So you need to adjust because the more higher your tag, the thicker will be your base plate. Yeah, when the base plate is thicker, your patient will feel not comfortable. The ideal thickness of your base plate should be 2 mm. Don't go beyond 2 mm. Because 2 mm is just nice. So I adjust again the tag. Because one of the things is we always need to adjust all that part sit properly. But sometimes we wrongly adjust one side, the other side will not. That's why you need to balance both sides. Okay, now you can see the Adam is sitting. Can see? Wait, now I adjust the camera a bit. Can see right? The arrowhead will be sitting on the cervical. He also is sitting. Then go into the interdental. Then the tag. The tag you can do any kind of design. What I say, you can customize it. Okay, understand? So I just do another wire bending to show you all the technique. The first one I bend on the model. The second one I bend randomly to show the technique to get a more clearer for you all. Okay, like just now I say, first mark the, for what? What you want to bend first?
The bridge.
The bridge, right? Correct. So I just mark like this. I just mark randomly at the bigger. Can see the marking? Everyone can see, huh? Okay. So we bend the perpendicular, go down. Can see right? The second one, go like this, bend it down. Until this stage, you all know, right? Understand, right? The perpendicular, the bridge. The only complex part is the arrowhead, right? Okay. Second, I just mark the height of the arrowhead. You can see the black color. Okay. So what the first thing is you do is take your plier, go in between. Can see or not? If this is the plier, go in between. Okay. If this third part, first you before the marking bend the perpendicular on both sides. Until you get this one. Can see? Then follow into the in between. If this is the distal facing your friend, then go up. Second one, same again, go in between, facing yourself, then you will achieve the both side. Senang. Sebab cincin. Oh, sebab saya pun tak perasan sebab kena tengok kamera, sebab tu saya macam difficult visualizer. Okay, nampak? Okay. Okay, sekarang saya akan agihkan wire. Kita akan bend Adam. Lepas tu kita akan bend second thing lebih pun nanti saya akan ajak lepas lunch.
Both side.
Yep. Sebab this one siapa yang tercantik ya, wire bending. Dan kita akan dapat hadiah. Tiga hadiah, tapi juru teknologi pergigian ortodontik tidak akan dikecualikan. So memang hadiah memang besar. Ada hadiah end of year. Kia Encik Syam.
Saya belum masuk pertandingan.
Syam dah lama tak buat.
Saya masuk pertandingan.
Oh, Encik Syam tak boleh. Encik Syam ni bekas juru teknologi pergigian ortodontik. Grup veteran tak dibenarkan. Ya, Encik Syam.
Kalau berdasarkan pengalaman saya yang kecil,
Just pass on me, just pass on.
as we go to other university, other outside student to come, they tend to they have different arrowhead sometimes. But in our UM, we standard like that, right? Sometimes I found outside the arrowhead like the triangle
dua sini.
More than you know.
Thanks, Diva.
Dia macam kacik sikit. Dia macam like that. Tapi before this one, I belajar yang macam tu. Tapi bila saya dah duduk kat UM, we found that yang this one is better.
Terima kasih Encik Syam. Betul, memang dia punya design bending wire setiap tempat berbeza sikit. Tapi ultimately yang mana bagi comfortable zone is tempat yang arrowhead macam kita. Sebab dia punya pressure point tu taklah very high. Kalau passion bila pakai dekat cervical, dia akan rasa impact macam ada pressure bila dia berikan makan ke atau nak letak something ke, then we have that kind of impact. So better macam ni.
So this one, there's only 2 points.
Yeah. So kita jangan confusekan sebab kita buat banyak passion. So based on the passion, the comfortability, I think this is better, this is the best. Sekarang saya akan tunjuk juga cara-cara. Kalau wire tak cukup boleh beritahu ya. Bukan panjang.
Menang
Ini
Ambil ni, dia boleh
pendek.
panjang kau ini. Legend ni kalau kau menang automatic.
Dua je.
Kata apa?
Dia umur nak, umur 15
Apa ada 3? Ada 3 price.
umur 15 tahun kita tak boleh buat.
Ya.
Dia umur 50 tahun ke atas tak perlu buat sebab dah legend.
Umur 50 tahun kita nak pencen ni.
Jadi auto menang, tak boleh kata apa ni. Oh, yang panjang tu boleh.
Bukan, nak ambil raja.
Dia nak siap-siap bawa ni.
Oh, siap-siap buat Hawley. Tak boleh. Yes.
Diva.
Oh, you don't have ah?
For you.
What?
No, I will ask the question. I think it's
I thought dia tak ada tanya. Ask so that everybody will.
No, I just want to reconfirm, is there any theory to show that the bridge and the shoulder cannot be the same height? Is it supposed the shoulder must be below the bridge or the ankle be bent? I remember one Jew teacher supposed lower than the bridge, right? The angulation. I don't know what you know what
The bridge should be lower.
This angle must be lower than the shoulder. Suppose.
Okay, actually from my finding from all the journal don't have anything specific about this, but what we say is can be acceptable because the bridge is very high compared to the shoulder means. That's why just now you remember or not why I'm holding together. Because if I'm holding together, you can be same height with the bridge or can be slightly higher. The shoulder can be slightly higher. Because if the bridge is higher than the shoulder, you need to think about the adjacent, the opposite side, the mandibular, the lower. When the bite, you cannot close. That's why your bridge should be slightly shorter compared to shoulder. Because shoulder is on the interdental. Because sometimes interdental is slightly higher than the shoulder, the bridge. Can get it?
Yes. So if you same height should not be a problem because sometimes I notice the two size.
Yeah, same height shouldn't be a problem.
Same height, right? Sometimes, especially I bend for the premolar, very high. The premolar, I very hard to achieve the curve.
Because the premolar, the interdental is slightly higher. So when you are bending, your bridge is like this, should be same height like this now.
Yes. So suppose will be higher than. I think this model should be okay.
Yeah.
Some model is very high.
Very high.
So
That's why you need to very accurately, you need to bend together along. If not, it will become very high.
And I notice is this mistake. I'm not sure it's a mistake or it's the correct way. I noticed some of the technicians they don't have correct the angle. This angle. I mean the
arrowhead angle, is it?
No, you look and then this angle. The straight way from this way bend according to the like from the you look.
You mean the arrowhead, is it?
no, arrowhead is like this, right? And then after that, after arrowhead, they adapt well according to the
To the tooth.
curvature of the tooth. Suppose there's an angle here, right? This one
Usually we
is
have we back at angle, but some people they don't want the angle.
they just make a
because
smooth curve.
they just make a smooth curve because
This
when
one
they
okay.
also because when activation it won't break.
it would
Because when it's sharp angle, the molecule in the wire will be break. So better when doctor activate adjusting, it will break.
all the break. So it's better to make a
Smooth curve. That's why as much as possible, that's why just now I tell to you, in orthodontic we try to avoid
A
a sharp angle. We always try to go for a smooth curve like that.
Okay, thank you, Diwa.
That's why we say there always a reason behind why we need to understand the theory, the basic, the foundation. Okay. Thank you, Kak Yi, for question.
Sebab I think lah, rasa sebab Kai tanya pasal yang teori yang belakang patut rendah daripada depan. Actually that happen because of the 45 degrees.
45 bukan dia punya Puan Kai punya soalan, dia kata kenapa bridge kena kadang-kadang lower daripada shoulder. Sebab kan shoulder kan tinggi, bila patient bite dia akan kena dekat lower punya.
Betul.
So sebab tu doktor dia nak pendek sikit. Supaya bridge tak kena dengan lower punya bridge. Bila mereka bite tak boleh tutup mulut pula.
Okay.
Can understand?
Yeah, let me bend the bridge first.
Okay.
Then for arrowhead, I'm going to call you.
Kalau siapa-siapa confuse macam mana nak bend arrowhead, confuse lepas bend dia punya bridge, boleh panggil saya akan datang. Okey. Cantik Ustaz.
Nak lukis ke dia buat? Tak payah lukis.
Lukis dengan highest mesial cast. Yep. So dia akan jadi imaginary line guidance.
So ni bahagian dia ni sebelah mesial kan? Betul macam tu?
Tadi Kak letak mesial kan?
Ni mesial.
Okey. Mesial.
Betul kan?
Betul.
Betul bend ke depan kan?
Bend ikut arah angle plier.
Betul bengkok ke
Okey, lepas tu closekan dia tu, pegang perut. Ya, clipkan, close clip. Betul.
dah lama, berapa tahun dah.
Tapi masih boleh.
Ni lagi ke 45 degree? Aduh, aku pedih-pedih mata dah aku ni. Aku dah pedih-pedih dah tengok.
Macam ni. Nampak tak? Kak letak. Okey, cantik macam ni.
Boleh?
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 Boleh.
Oh, jadi ya?
Jadi.
Okey, jadi.
Just kat kena. Closekan sikit. Pegang together.
Oh, tegak kan?
Tegakkan sikit.
Tegakkan lagi.
Okey dah. Macam ni. 45 degree nampak kan? 45 degree. Lepas tu bend shoulder.
Okey, thank you dia.
Nampak macam ramai akan lulus ni. Semua band cantik-cantik.
Kenapa tak jadi?
Dia ambil gambar apa video ni?
Alah.
Tak jadi.
Kamu kena ready. Let's go. Oh, you dah jadi dah. Sebab apa?
Pengen nak bawa pakai itu, baik tu.
Tak boleh.
So siapa yang band cantik, 3 orang akan dipilih. Dia dapat hadiah yang besar, bukan hadiah kecil
Ini satu je.
Kan Ben?
Tak buat.
Sweating. Panas. My hand is watering.
Shivering.
No, I feel hot.
They all started sweating already there. Until you got the aircon.
Ekor ada? Aircon dan 16 degree Celsius dengan centralized 3 biji panas bermaksud coach. Jadi tak jadi. Sebab kita dah on 3 aircon center.
3
Saya panas.
Jadi Diva. Macam payah je aku tu.
Macam payah.
Oh, udah Diva.
Benda tak payah Kak. Nanti Kak just on Ain just bend ikut teknik. Terus macam ni kan.
Kita letak macam ni juga kan.
Terus macam ni kan. Jadi Kak
macam mana? Tak jadi yang
terus dah ni kan tadi.
Betul.
Okay. Kalau yang ini distal, mungkin ini distal, ini mesial. Kak just masukkan in between.
Betul.
Just sampai tip je.
Betul.
Hold tangan macam ni. Facing awal. Naikkan je. Nampak tak?
Kakak ni tak jadi ni. Nampak kan?
Jangan. Sekarang ni.
Pendek.
Tengok ni. Ni, kakak punya ni. So macam ni. Ke
Betul, macam ni.
macam
Betul.
ni. Bukan.
Bukan betul tadi macam ni. Sebab ni akan lock kat sini.
Susah lah.
Yang ni dia akan tip. Dia akan tip. Lepaskan sikit tak? Okey.
Pegang kat mana duduk
Dia tak payah
Batal.
ukur
Okay.
lah ni.
So first one facing Kak.
Face masuk dalam.
Yang ni dia tak payah ukur nak berapa.
Kak pegang macam ni. Ustaz, bagi Kak.
Ni yang kita buat tak jadi.
So bila Kak tak macam ni kan. So Kak tolak macam ni. Pegang macam ni. Dia lock sebab bila Kak tolak dia tak akan gerak. Kalau macam ni, bila Kak tolak Kak dia akan gerak. Sebab tu kita pegang macam ni. In the interdental, slightly tepi. Sekarang tolak. Selain first one, Kak boleh tolak facing yourself lah. Tolak macam ni. Lepas tu naik atas.
Try.
Pegang macam ni.
Sebab yang ni dia tak, dia panjang dia tak payah ukur kat sini lah ya.
Tinggi dia sama dengan bridge. Ni je.
I punya tak jadi tau.
Dia tak boleh lagi tinggi daripada crown. So Kak punya bridge, dia punya height kalau sebelum mungkin setinggi dengan bridge.
Tolak ke?
Dia punya U dia ni.
Betul
So kena U agak pendek lah ni kan.
Dah lock.
Kan pendek kan.
Lepas tu
Kak boleh adjust dengan shoulder, tinggikan sikit pun boleh. Just Kak buat macam ni. Dan sekarang Kak Kalim just hold,
wait baby.
just tinggikan sikit.
Okey, lepas tu
Letak,
ukur balik.
lepas tu baru bend.
Oh, boleh.
Okay. As long dia punya bridge tak lebih tinggi daripada crown. Kalau tak dia punya lower bila bite dia akan kena dengan dia wire. So pressure tak boleh tutup mulut.
So dah tolak kat kita tu.
Okay, lepas tu Kak naikkan.
Sekejap, dia gerak. Macam tu.
Kak kena, tangan Kak kena rapat dengan tu.
Ada jadi ya.
Tapi besar lah you dia.
Sebab Kak tadi pegang, Kalau kak punya tip ni, plier ni, dia kena hold dekat tip dia.
Hujung tu.
Kalau kak buat, tadi saya kak pegang macam ni, sebab tu dia besar. Dan tadi saya kata student yang selalu punya mistake, dia akan letak sebab dia takut grip tak cukup, dia akan letak plier dia sampai dalam. So dia akan jadi besar. So kita punya grip, yang plier yang saya bagi semua, grip dia cantik. So just pegang dekat sini, tip, pegang kuat-kuat. Okay, ini dah lock. Facing saya, naik ke atas.
Nampak senang.
So dia dapat dah macam ni.
Boleh ke boleh. Jadi dia dah kepak, boleh.
Boleh. Boleh. Puan Ayat kata boleh.
I need to know how you bend the arrowhead. How should I hold?
I take one more wire and come and show you. Kalau wire tak cukup, boleh beritahu ah.
Ini sangat foto.
Baca Arifin. Okay. Just now we bend like this, right?
Okay.
This. Then we do the perpendicular like a leg. Okay, this is the stage, right?
Yes, yeah.
Okay, first one. Jadi if this is the missile, I hold like this.
If this is the missile, I hold like this. Wait.
Okay, this missile I hold like this. Okay, in between. Why we do like this? Because if I hold like this means it will move.
Wait, you show me with the tip how you do.
Okay. Okay. This the thing.
Kena save ni. Kalau tidak dia confuse.
Okay, when I bend like this, alright. Okay. If this the missile, usually I will bend missile first because usually missile the height will be slightly higher than the distal. So I put in between like this. So only the Adam plier tip is here.
Okay.
If you bend, put in so a lot, your arrowhead will be very big. That's what the common mistake the students will doing. So we hold here, facing like this, like myself.
Wait. I want to look at face the model. Is it? You have to face the palette.
Like this, then bring it up. Or not? Then I will close a bit.
Saya rasa dulu Puan Fatimah tu buat macam ni kejap.
Then second thing is distal, right? Holding from outwards.
Okay, wait. I have to hold the tip here. Then I have to face inside.
But this one you need to lock like this. So this one is a distal, I think.
Yeah.
So distal facing outwards.
So I have to lock here.
Here. Then push outwards like this, Distal, push outwards.
Push outward, but not much.
Not much. Until like this.
So
Okay.
align with this plier.
Yes. Then push it up.
Then push it up.
So that's why you need to hold this one like.
Hold where?
Your hold must be very close, tight, strong.
Then I have to bend. Oh, this is a bit challenging part. Very long I didn't do.
Sekiranya kita nak bend
可以，等下需要你的帮忙拍照一点啊。我们教书这个前面啊，如果我要 upload 那个东西在上面的。
biasa kita bend ni dia ada punya penanda tu kat
Oh, okay.
kan. Yang kita tanda tu biasa dekat betul-betul dekat situ.
Betul lah situ. Understand?
Yeah, let me try.
Then if the arrowhead is slightly bigger, try to close it. Don't be so close because later difficult to activate by doctors. Yeah, close some more. Okay.
Or some more.
Enough. Then another side, same. Now for outside. Like this.
So I have to hold the tape here.
Yep. Then you need to correct. So this will be locked. Can see like this? No, this one will be like this.
I have to lock like that.
Yeah, so that it's not moving. The tip. Okay, now facing outwards. Hold tight. So this one your plier need to hold tight.
Move inward, then
then
push up.
push up.
Ini datang tak siap.
Sure, setting already.
Sweating.
Yeah.
That's why it's very common because for people who newly band and new things, sometimes we sweat a lot.
Yeah.
Those who are like CP, everyone will know. Automatically your body will start to sweat and become very hot. Even though the aircon is like cooling or something like that. But I know. Yeah, but 16 degrees Celsius. But 16 degrees Celsius already. 3 aircon ni 3.0 kan?
Ya, tangan saya tu ada. Kesian aircon. Kan aircon yang dipersalahkan.
Buat ni sikit.
The one looking for the behind one. Someone to jump to some music.
She's the informatician.
Oh, okay. I thought she's the someone.
Semua dengan balon sekali. Kenapa tadi lama? Something wrong.
Kau tak cukup tak. Dia kena sit up.
Dia tak ketat pun.
Dia duduk. Masa kau duduk.
Ya. Tuan Cedin, ada buat design tak untuk tag?
Tengah buat design ni.
Design tu.
Nak buat huruf H terus.
Hari pay.
Tak tahu buat huruf H.
Hari ni je. Hari ni, satu hari je.
Hari ni je.
Puan Ain, okey? Puan Nurul, boleh? Okey.
Air tengah air.
Okay?
Is this size okay?
Yes, correct.
This one I should make it smaller, is it?
Yeah, can make it smaller. Just make it like this. Close it. Close it.
But if you want to bend at the interproximal, still you have to do marking, right?
Yeah. No, actually no need to marking also. Sometimes you just can just hold together like this. Bend it.
Kalau orang yang dah susah.
But how sometimes if the interproximal area is high?
It's just nice like this.
So how don't you make marking to bend?
No need to marking. Usually what I will do is I hold here because this will be same height the
I
bridge.
can't see, right?
Same height with the bridge. So I bend towards myself, go up. Then I will adjust little bit by little bit.
You have to bend towards this side because you want this thing to go this way.
Yep. So usually if you marking it will be difficult, so we hold it together, then we bend, go outward.
Wait, let me try.
Then we can adjust the shoulder little bit by little bit.
So now I have.
Usually I will bend the mesial side first.
Oh yes
Because mesial usually be slightly higher.
Okay So I have to hold like this.
Hold together.
I push outward.
Yep, outward this side first. Okay. Then facing straight. Same line with your Adam. Usually your hand must be very close to him.
Oh.
As much as possible, you need to be close. And then you adjust a little bit, some more. Okay, correct.
It's hitting the.
Then you adjust, you like this hitting, you just hold here. open up a bit. So you can see it's nicely sitting like that. Now you're marking from here, then you bend slowly go down.
Okay.
From there you're marking, you hold here and go down.
Thanks juga.
Welcome. Warna rich boleh?
Nak bentuk masuk sini tu dah tak ingat.
Buat dua ke satu?
Dua.
Dia band tolak kan?
Satu pun dia nak pencet.
Ke salah band?
Mana ni?
Betul.
Betul? Betul. Okay, betul. Sekarang kat marking dekat sini.
Band masuk.
Tak. Bukan band. Sebab dia angulate sikit kan. Kan just bend macam ni sikit. Lepas tu bend lagi. So, turunkan dari sini, turunkan bawah.
Iwan cuba check Iwan. Saya dapat rasa.
Okey, saya tak nak check.
Kena tidur je.
Acceptable. Acceptable tu acceptable tapi kena adjust sikit.
45 degree tu je lah. Tak ada sikit. Lagi sikit.
Adjustable. Okey, tapi kena adjust sikit. Dia kena hold sikit. Okey, macam ni sebab dia naik ke atas sangat kan.
Tapi yang ni macam tinggi sikit lah. This one. This one. Oh, this one.
This one tak apa sebab dia masih gigi dia masih highest cast okey lagi. Dia tak lebih daripada cast dia.
Dia punya ni macam sama tinggi dengan dia punya ni. Tak apa.
Tak apa, boleh.
Oh, tak apa.
Yang sekarang yang kacau yang ni.
Kita maksimal tu.
Dia dah pergi dekat sebelah jiran. Kacau jiran. Kita jangan kacau jiran. Kita adjustkan balik sikit.
Macam naik atas.
Okey, dah adjust dah.
Okey. Naik adjust lagi tak? Tak payah.
Tak payah.
Naik. Okey, buat sebelah ni pula lah.
Okey.
Alright, cun. Acceptable.
Acceptable.
Acceptable. Alhamdulillah, satu baru.
Tapi first time baguslah. Puan Halimah. University later need to have tangkap gambar apa-apa boleh tak? In case like tangkap gambar if I teach time. Because I need to upload in the system. Because recording photo all need to upload.
Tak wire, nak ambil wire ke?
Ya, Encik.
Banyak cantik.
Yep.
Buat lah tolong.
Buat bagus.
Saya kau tunjuk cara satu.
Legend boleh. Cara. Okey.
Saya kau tunjuk cara satu.
Jangan.
Saya bawa wire extra satu lagi.
Dia sengaja.
Sebuah kereta Alza. Okey. Cik buat kan selalu. Mungkin saya dah mark sini lah. Just buat ni. Selalunya arrowhead ada problem.
Tak payah jemaah.
Yang bridge tak ada problem. Selalu senang je. So selalunya orang dah sampai setakat ni. Okey, macam ni kan. First, kalau saya selalu saya akan buat kat mesial part dulu. In case this is mesial, this is distal, saya masukkan dekat tengah-tengah. Selalunya dia ada tip. Okay. First, saya akan face towards me. Saya akan hentikan diri sendiri dulu. Lepas tu, naik atas. Okay. Kalau dapat dah macam ni. Macam distal, dari luar, masuk. Macam ni. Sebab kita dah kena lock. Kita bila push, dia tak gerak. Kalau kita buat macam ni, dia gerak. So, kita nak lock dia. Baru itu letak sini. Bila kita push, tak ada masalah.
Dan push ke atas.
Push ke atas. Dah keluar, kita klik together. Close kan sikit.
Bagi dia U lah.
Lepas tu kalau dia buka kaki board banyak sangat, kenapa nak buka kangkang banyak sangat? Kita buat macam ni. Kan? Tu, just letak. So supaya dia punya height tak terlalu tinggi, saya akan hold dua-dua sekali. So first kalau saya bend macam ni, dia akan licin. So apa saya buat? Nak sama height dengan bridge, lock, tolak. Lepas tu baru saya adjust lah tinggi nak macam ni ke, nak kurangkan ke, gitu. Same. Lock pegang sekali, facing myself. Then dia ni kan,
Dia kenapa perlu tinggi sama?
supaya kalau tak, bukan tinggi sama, so nanti kita boleh adjust senang. Supaya dia ni tak tinggi sangat. Bila kita letak supaya dia tak tinggi sangat. Adjust ni sikit. So kat sini kita boleh marking, pencil marking kat sini. Baru kita buat.
Saya buat satu ni.
Nampak tak? So adjust lagi sikit. Okay. So macam ni saya nak turunkan dia. So dia ada contact point dekat sini. So saya akan pegang,
Rendahkan dia.
rendahkan dia je. Okay kan? Lepas tu dia dah akan masuk tag. So nanti saya akan adjust sini sikit lah. Sap-sapsoi kan? Sekejap je.
17 tahun.
Sap-sap-soi.
Masih ibu kata sap-sapsoi.
Masalah rambut
Kau nak okey?
Ha?
Okey.
Boleh lah kot, tak tahu jadi apa.
Boleh lah kot.
Dikelilingi auto semua. Buat tak
Pasti
tahu.
ada kekuatan yang tak terhingga, tak nampak.
Nampak dia dekat auto
Ha?
Music.
Music
Nak
please.
beli wire.
Wire bending music please. Saya cakap pun dah macam nyanyi dah. Kan? Suara saya merdu tak? Dah tadi lukis love semua. So nampak suara saya dah merdu dah. Tengok je Arifin dia buat wire bending sambil nyanyi lagu.
Tak pernah aku menyangka rupanya aku kena band juga.
Tengok dia enjoy buat wire bending sampai nyanyi lagu. Tengok.
Saya nyanyi untuk suka ni. Senang. Kita boleh buat.
Nyanyi untuk Puan Sutaya dapat semua dah rekod kan.
Jangan kacau boleh tak? Ni kau kata eh?
Cik Syam dah band. Dua side lah. Lagi satu.
Lagi satu je.
Dawai tak ada.
Kawan tak ada.
Dawai tak ada.
Dah saya kisah.
Tak tahu kami.
Besar ya.
Abang ni saja.
Abang saja ya. Tiba-tiba accepted tak? Accepted dia tanya tak? Tanya satisfied. Accepted tak?
Accepted agak.
Boleh lah.
Boleh lah. Tapi nanti pemarkahan dah dapat hadir, kita tengok semua. Boleh continue the next one. Kalau lepas dah second one dah habis, tengoklah cantik tak cantik, nak bend balik ke.
Rasa-rasa nak bend balik.
At least Adam Plus ini ada teknik dia macam tadi saya ajar kan, macam nak hold plier. Untuk label bow rasa lagi susah. Dia tak ada teknik, you kena buat judgement, estimation. Kai done already?
Oh, no, sorry, I on call just now. If tak jadi, cannot do anything lah. The prof already help you, and then
Siti
someone
okay?
is the Chinese doctor.
Siti okay?
Okay.
Baik.
Oh, ada lah. Mata tak nampak ni.
Mata tak nampak.
Rabun ni.
Mabun dah. Pakai spek tu apa? Tak bawa je yang apa? Spek.
Spek legend ni.
Oh.
Malai nak. Malai nak jalan.
Yes.
I already bend here, but actually I want to bend this some more lower. How you will bend?
Okay, if you can't, once you bend it, it's very difficult to bend it lower.
Oh.
Except me. We're slightly hitting the teeth, right? Open a bit. And you bring it down. Hold here. Go it down.
Hold in the center, bring it down.
Open a bit.
A little bit.
Yeah, then bring it down. So press a bit down more.
Thank you very much, Iwa.
So when you press it down to up, then it will go follow the curvature of the interdental.
I still have the bend down, right? I
Yep,
still push up.
bend a bit down.
Thanks, Iwa.
Yes, welcome. Jangan paksa Adam duduk ah. They can just letak duduk. Diva mesti okey. Apa kak? Hari pertama mandi.
Thursday. Jangan sakit Diva nak tolong.
Nak beritahu dia, kalau buat Adam memang
Tapi cantik. Okay, not bad. Beginner bagus juga.
beginner lama berapa tahun, 10 tahun lah.
Tak apa, ini refresher course. Lagi 10 minit kita break.
Tunggu sampai tu tukar bateri.
Nanti bateri kan tukar kot.
Dan ni ada lagi, nanti yang ni pakai baru juga. Nanti I nak cek.
Okey.
Jadi kita nak pukul 1.
Pukul 1. Baik, masuk dulu. Informatik. Baby dah siap satu, Kak Norish dah siap.
So a bit.
Dan this side, this one a bit difficult a bit. Normally வந்து distal on arrowhead வந்து கொஞ்சம் higher lower இருக்கும் distal. Missile வந்து higher இருக்கும் because the compensating curve. The compensating curve வரப்ப அப்ப இருக்குது the distance வந்து கொஞ்சம் short.
So it should be opposite lah.
Ini boleh terima ke?
Tengok boleh terima ke tak boleh terima.
Sengit tak? Kita nak ambil yang baru. Wire. Dah buat azab. Boleh?
Cik boleh.
Boleh guna? Boleh?
Boleh, just dia punya. Saya buka sikit
Boleh. Dia buka yang mana?
Arrowhead. So arrowhead dia macam terlalu buka kaki dia.
Boleh? Masukkan dalam.
Masukkan dalam. Lepas tu saya tinggikan balik.
Oh.
So dia akan ada sana. So bila kita letak, nampak tak?
Okay.
So dah adjust, turunkan balik dalam tu.
Okay, boleh. Boleh. Thank you, Diva.
Okay. Kadang-kadang kita boleh adjustkan balik dia punya komponen. Just kita tak boleh adjust terlalu banyak kali. So bila kita buat terlalu banyak kali, dia punya wire atom dia akan jadi loosen. Bila loosen dia senang patah. Encik Hisham dah band dua-dua dah siap dah.
Lalu ini yang sengit.
Dah 45 degree dah terlalu.
10 dapat bawah.
45 degree dah terlalu banyak.
Sengit kan?
Macam dia punya 45 degree angle terlalu banyak dah. Takut dia kena cheek.
Yang ni? Kan?
Dia macam terlalu terbuka.
Betul. Dia terlalu sengit lah.
Pakai datang kita punya veteran.
Veteran dah mati dah kelabu ni kau tak?
Mata dah kelabu.
Dah tak nampak.
Siapa yang je? Ada a lot lah.
I think never mind lah. I have to press.
Custom lab lah. Memang custom tinggal lab mau custom. Ke 5 minutes break out boleh.
I think should be okay. Kau isi.
Kata sindi பண்ணிட்டீங்க. Memang we welcome to the auto.
Aduh.
This is a part of the auto.
I remember, Penang also always get hurt one.
Okay, just want the tag slightly higher. Just need to adjust the tag a bit.
I think
Because
this
here,
side that,
here sit ready on the selector nicely. Okay, so here, I just have to adjust the Okay, ready? Then this side.
Oh, thank you so much, Amira. Thanks. Okay.
Okay. This
Thanks,
one,
Shiva.
nice. Just nice. Completely. It was nice. I say very good lah. The angle also you can see from the label. 45 degrees. And sitting the palatal space also.
Only my tank just now was a bit high. Okay, thanks,
Mine
Shiva.
is nice. And later can continue. After lunch can continue for the second one.
Dia jual satu.
Oh, main jual-jual.
Meja jual lah.
Ini macam masa belajar ni. Dental student tanya dekat dental tech. Kat masa Syam.
Aku.
Cik Syam, masa dekat belajar kat masa budak DDS. Satu komponen RM5.
Oh ya.
Part time business.
Oh betul, satu komponen RM5 betul.
Tapi saya dapat dua yang belakang.
Oh.
Itu tak ada tu. Bawa program main tengok satu. Cik Ramli je. Cik Songa. Belajar sini banyak. Semua faham macam mana band? Okey, tak faham? Nak pertolongan? Boleh panggil saya akan datang ajak cara aku. Tolong buat tak boleh. Tujuan kita buat workshop training sebab nak ajak buat Hawley retainer. Tapi saya nampak kebanyakan semua boleh band.
Ini
Walaupun tak perfect, saya nampak kebanyakan boleh band, boleh dapat passing mark dah.
mana gaya tu? Kau balik mana saya? Pusing. Ini gaya dia.
Tapi apa the lab? Kita sampai itu.
Okay, pukul 1 start lunch ah. Pukul 1 lunch, lagi 2 minit macam tu je.
Gaya okey gaya.
Patah.
Yes.
Can see the patah one ah.
Baby dah lapar. Baby kata mami.
Tengok ni, kalau kita bend banyak kali dia akan patah. Okay, kita dah stop sekarang. Continue after 2. Okay, kita continue after lunch. Terima kasih. Ni nampak macam siapa pun tak nak pergi lunch ni.
Semua tak fokus.
Semua fokus lah.
Jangan disiapkan juga sebenarnya.
Semua fokus pagi pergi lunch nampak. Oh, semua fokus. Okay. Okay, sure.
Kenapa? Tak. Oh. Boleh menang tak?
Dan kecualikan.
Terkecuali. Bagi dah menang.
Bos lah. Cantik.
Bagi dah menang. Okey kali, tipu kali. Dia pakai saya punya cepat. Tiga okey tak? Menang tu bagi hadiah.
Diva okey. Diva okey. Poin Diva okey je.
Ni Adam Diva.
Diva okey je.
Diva okey je. Tu ajak ayat aku dengan student je tu. Sakit tangan aku.
Siap lah tu. Banyak kita
Oh, dah siap dah ni.
Tak siap lagi?
Dah siap. Tapi just bahagian tag ni kena turunkan sikit sebab
Tu kalau kena mukosa tak apa ke? Tak boleh?
tak boleh kena dekat palette.
Ni kalau ikut tak boleh kan?
Kena sikit apa sebab dia ada bahagian lain yang ada space. As long dia ada pemegang akrilik tu.
Oh, faham.
So akrilik
kalau
boleh masuk dalam.
Kalau terdapat sikit pun tak apa lah.
Dapat sikit
Okey,
tak
kita
Jadi dia
turunkan sikit.
Just dekat tag, kena turunkan. Kalau tak dia punya base plate akan tick.
Thank you, Diva.
Thank you.
Wajah kita tak siap. Kita siap lah tuan.
Yang ini senang, yang sini susah lah sebelah tu.
Inilah top student kan, dia berisi ubi.
Bangun.
Kenapa?
Boleh lunch dulu. Kita akan start dengan label bow, activity 2 dengan label bow. Before that, semua dah makan kan? Puas? Macam mana first part? First half okay? Okay. Good. Okay. So can understand? Okay. So next another challenging part is activity 2. It's a wire bending on the label bow, the fabrication of label bow. So I will do you can see near the screen here because I will project two things, one in the TV on the slides and another part is a hands-on demo under the projector. So first we go for this is the label bow arch wire which will be usually bend from 3 to 3, canine to canine. So basically the arch wire is holding the canine 3 to 3, the lateral incisor, central incisor all. You see right? So we use the 0.7 mm wire and this one is the component. So this is the arch wire, we call it the arch wire, and this is the U-loop. And the U-loop should not touch the tissue, gingival tissue, because the patient tend to have ulcer at the butt. So same as the Adam class just now, the arch wire also will be divided into a few parts, which is this is the arch wire, or called as the bow, label bow, and here will be the U-loop. Then the U-loop will go to shoulder and the tag. So this is the U-loop, which we always start from the canine. In case, for example, this is the canine, right? Some technician, because the label bow have two functions. One as a retentive, just to maintain the position of the canine to canine. Once they debone, they just want to maintain. They don't want any movement. They don't want to use assist retainer. Then they just can do the wire bending. Some they will do from the middle of the canine, like this. But it's very advisable is you start from the 1/3. Yep, from here. Yep, like this. The reason is, if just for retentive purpose, that shouldn't be a problem. If you want to activate, in case you have a gap, midline diastema, something like that, and the doctor want to activate, then it's better for the U-loop is slightly bigger. So the doctor can close the U-loop, so it retract. So when they want to make it activate, we can show you okay, for this kind of thing, right, the doctor will trim this area, so that when doctor want to activate the U-loop, the base plate they will trim off so it can come in. If the base plate we didn't trim, the doctor cannot retract the teeth to close the gap. So what the doctor or orthodontist will do, they trim off the base plate here, the anterior part, then they will activate the U-loop so that it will pull and retract together to close the gap. Okay. Another thing is I should emphasize is that in case the distance between the cervical and the U loop should be 2 mm. It should not be too long. If the U loop is too long,
2 mm from the cervical margin.
yes, you can see from here, it starts from it divided into 3 part, 1 part, 2 part, 3 part. The 1/3 it start to bend. So the cervical and this one should be around 2 mm. 2 mm. Don't be too long. Consider this one actually is long. In this picture is slightly longer, should be here. Because too long, the patient complain and they say that aesthetic part will be affected and it will be start to very flexible. The more longer the U loop, it will become more flexible. So when flexible, sometimes it will disturbing the tissue part. So that's why we need to be shorter slightly until here, then go into the shoulder, then the interdental, and we build the tag.
And then the arch wire should be in the center. Is
Yep. That's another thing is I want to emphasize is usually what we will do is your arch wire should be in the middle like that. But they also got concept you need to understand. Like what I say. In case this is the from lateral view, central incisor. This is the incisor edge. Incisor edge, right? This is the root. This is the root. If your wire in the middle, in here, the force when doctor activate, the force will be just pull nicely, like smoothly towards retract the teeth. In case your wire at the near to the incisor edge, then it will become retrocline. Your teeth will become like this. So because the force is applying towards the incisor edge, so it become like close. If the overjet is very a lot, then you can place the wire near to the incisor. If you do apply it here, it will become procline. If you're too low. So that's why the mechanical force is very important where you want to place your wire. Yeah. So the best is you need to put the center. Because you wrongly put near the top of the incisor edge, then it will become retrocline. If you put below the middle at here, then it will become the procline. Because when the doctor activate, you want to close the gap, but actually it close the gap, but the teeth become overjet, become increase. It become procline. So the force also you need to see. That's why we need to very think ahead. By the orthodontic dental technologists, we need to think ahead what will happen if we place the wire in the wrong place. Okay, understand right? Yang ni boleh faham kan? Kenapa dia punya force wire kena letak dekat tengah-tengah, hampir dekat tengah-tengah daripada dia punya arch canine to canine. Supaya dia punya pergerakan gigi dia tak jadi procline ke atau retrocline bila dia tutup gate. Dia just nak tarik smoothly itu. So one part is that. Okay. If you see this, I will draw it over here. Okay, your things should be like this. So you can see, right? So it will come until the 1/3 of the canine, mesial canine, 1/3. Then we will do the U loop, and the tag will come into the palate area. And the arch wire should be smooth enough, should not like jiggled and all that. Yeah, it should be smooth. I know most of the time we cannot touch all the tooth. As much as possible, you should touch at least 4 tooth, something like that. Because our lateral incisor, according to dental anatomy, it will be something slightly 0.5 mm inwards compared to the central incisor and canine. So we touch as much as possible. But in some lab, I realized, because as what I say, there's always difference between a qualified technician and unqualified dental technician. They don't understand the concept. What they do is, they will bend, just follow the teeth. They just ikut je main. Kita selalunya lebih baik kita smooth je, nak tarik sekali. Tapi dia buat apa? Dia bend, ikut ke masuk, lepas tu baru buat you look. That's why we say we need to have the basic understanding on what we are doing. So anyone can bend, but can everyone bend with the scientific reasoning behind the evidential based design? That's why we go this workshop and do this training today. Okay, so now I will do a hands-on, show you how to do the label bow. I see most of you have done the Adam class, and everyone I think can do already. Haven't done. Tapi semua tengok dah buat dua cantik tengok. Okay, off the light. Dah tolong off light. Lampu depan boleh tolong. Okay, so everyone can see, right? Usually once you get the model, the most easiest way is I will use the normal like 2B pencil, bukan mechanical pencil. Saya akan guna 2B pencil. Saya akan letak terbalik macam ni dekat tempat yang flat. Once you put on the flat, you just touch on the anterior part, because sometimes dia akan naik. So you can touch, bagi dia punya incisor canine to canine, touch the flat surface. So dari situ saya akan guna pensel, letak dekat dia punya surface. Saya just akan tarik macam tu je. Bila tarik dia akan dapat satu straight line. Nampak tak? Can everyone see? Yes. Then the second thing is I will draw the U-loop. The U-loop is start from the 1/3 of the canine. Can see, right? So when the U-loop is start from 1/3, you can do the activation. The clinician, you, not us, but as the orthodontist or the dentist, you are able to do the activation to close the gap, to retract the teeth. So they will trim off the acrylic here, so that they have space for them to trim to retract the teeth. Same goes to another side. So you can see, boleh nampak kan? In case kita buat dia punya U-loop dekat tengah, the doctor cannot activate much. They have a limitation. So usually in the middle, they only do for if you can confirm that don't have any movement activation, just to hold the position of the teeth, then you can do at the middle of the canine. But for safe side, for the best practice is you use the 1/3 of the canine to do. So in case they want to activate or they want to just for retentive purpose, you can just go on. It won't have any issues. Second thing is now we will do the wire bending. For this case, for Adam, actually just now we did with the Adam plier only. But for this, we need to use a spring former along because have the U-loop. Okay. First, I take the wire, okay, I smoothly bend the curve. You can see this is one of the slow way. You need to bend slowly like this until you get the curvature, smooth curvature. Another shortcut is sometimes you find the people who doing the gold ring everything, right, they having a kind of tools. Pernah nampak tak? Ada tools dia, measurement yang ringnya. Then you can use that. You just bend. Actually, they got sell for the dental also, but same material they use, but under the brand of shoe. I think they sell it for $500, but you go to Shopee, you can buy just 30 ringgit only. Just because the dental stuff is cost around 500 ringgit. Then just bend. Oh, another thing is, if you want to more cheaper cost, place like this, a round place. You can see something like a stand, a small stand, round. You just can put here. Just make it like that. There's a shortcut way lah, in case you feel very difficult to bend like this. So every time you bend a little bit, you check and see on the model, okay or not. Then I need to bend some more. So every time you bend the curvature, pull on the model and check back, is it okay or not, for you to continue with the other stuff. Sometimes what I do, I just use spring former, I hold it. But you need to do very smoothly like that. You cannot use rough, you need to like slowly play with the wire. Sayang-sayang lah sikit dengan wire. Kena manja dengan wire.
Cincin dia pakai lagi ada.
Alah, semua nampak cincin je.
Tapi bila kita tengok cincin tu, kita cuma taksi berat dia.
Berat dia. Tengok, tanggalkan balik. Okay. Can see now? Can see that? It's smooth. Now it's a smooth curve. Okay, can see that? It should touch as much as possible too. If you can touch 4, it's very good. 5, 6, if some at least 4, try to touch at least 4. Because I think for this case I think you can touch even 5 or 6 also can touch. Because I realized the lateral incisor, the doctor have treated slightly same level with the central incisor. Nampak? Nampak kan? Okay. Once you're done with this, then we do the marking again. Marking dekat mana kita nak bend, you look. So, here's the marking. First marking is dekat sini. Then second marking at the other side. Okay? Boleh nampak marking kan? Okay. Second marking pun boleh nampak. Okay? Okay, from that sekarang boleh nampak marking dua side. Use your Adam. Use your Adam, hold it, bring it down. Same goes to other side. Hold the Adam, go down. Nampak tak? You can see right? So normally we cannot place like this because got the model right, base right. So as usual like Adam, we need to reverse it untuk make sure dia punya height. Reverse kan dia. Lepas tu mark dia punya height for the U-loop. Nampak kan? I mark. Okay. Then we go for another side. Okay, mark ready kan? Then only we start to bend the U loop. Take the spring former, place at the marking line. Just on the marking line, right? Just before that, marking. Hold it. You need to estimate the size U loop too. That's the challenging part. You need to estimate what's the size from the 1/3 to the distal of the, from here to here, what's the distance. So if you are very often you use the spring former, then you can roughly estimate. If a new time, I know it's challenging, you need to estimate how much you want to put. Whether you want to put like this or want to put in a bit. So you need to be very careful. This one based on the experience. Even we ourselves, myself, sometimes it won't take place. It won't succeed. We need to bend again. Because if we don't have an accurate measurement how much we need to place the plier. It's just come after the experience only. So I place. Then one side bend like this. Okay, right? Then I go for another side. When another side I see this side is slightly wider compared to this side, which means the upper left is slightly wider compared to upper right. So I place a bit slightly in some more. After bend, I place back and see. Nampak kan? Then you need to adjust a bit. So I adjustkan little bit by little bit, you loop everything. So you can see now. So once like this, then we can start to bend the shoulder. The shoulder will be like this. Right. So I will hold the plier over here. Can see that? It's touching on, sitting on the shoulder there already. Then once it's touched the contact point, there's to the mark over here. So far everyone can see, right? Then I settle with one side tag first. Then I cut the excess tag.
Sebenarnya katalah K9 itu saiz dia besar.
Ya, Encik.
Kalau K9 itu besar, kalau dia tadi tengok Iwan cuba bahagikan untuk dulu. Dengar. Contoh. Oh sini. Okey, contoh katalah K9 itu saiz besar. Tengok tadi di tempat tadi untuk K9 itu dibagikan kepada dua kan?
Ya, kita bagikan kepada dua.
So kalau K9 itu besar, tak ke nanti U itu terlalu besar?
Sebab tu okey, memang dia punya memang dia punya U loop akan jadi besar as long dia tak pergi lebih daripada cervical ni. Cervical ni jangan terlalu panjang. So bila dia jadi panjang, dia lagi panjang, dia akan jadi lagi fleksibel. Dan mungkin masa activation dia akan touch tissue. Sebab tu dia wide tak apa, dia lagi senang untuk activate as long dia punya U loop ni dekat dengan cervical. One thing sebab dia nak activation tak fleksibel sangat. Kedua, dia dapat buat predictable. Aesthetic wise pun dia akan jaga.
Daripada cervical margin tu
1mm to 2mm je. Jangan lebih sangat. Maximum 2mm. Sebab ada dekat tempat luar private, mereka tak faham konsep. Mereka just bend sampai dekat panjang sampai sini. Bila panjang sangat, dia bila doktor activate, dia akan start touch tissue. Bila touch tissue, dia akan jadi ulcer. As time goes on, patient will start to have ulcer, pain, all that. Second thing is dia sangat expose. Aesthetic wise, patient akan rasa macam bila senyum nampak ada wire panjang sangat. Tak estetik. So one thing is that also aesthetic wise and also functional wise. So kita always need to think both these things in our mind as a dental technologist. Aesthetic is one of the primary concern for the patient. As a dental technologist and clinician, we need to think about the function, whether it's really function can work well for our treatment plan. Terima kasih Encik Rosli sebab keluarkan soalan yang bagus. Hello. So setakat ni, hello, boleh dengar kan? So setakat ni nampak kan? Dia tag ni semua. So kita akan buat adjustment nanti. So macam ni, kita akan continue bend dia punya tag lagi on another side. Same thing, kita akan hold dekat sini. Ada certain people mereka akan bend dari sini. Kalau bend macam ni, dari sini dia akan jadi sharp angle. So kita nakkan dia punya curve yang smooth. Dia nak ada curve smooth kan. So saya akan startkan dari bawah sini sikit. Slowly bend sikit ni. So kita kena, dia akan ambil masa untuk kita adjustkan dia punya one by one. Sebab kadang-kadang we adjust this one side, upper left, upper right pula dia akan change. So you need to try to balance slowly one by one, correct or not, everything. Okay. Okay, lepas bel macam ni, I will mark another side.
Itu ada tak dia punya maksimum kelebaran?
Setakat ini I didn't come across standard scientific yang katakan maksimum kelebaran berapa banyak. Just dia punya vertical height yang saya kata you look tu tak boleh lebih daripada 2 mm cervical. Itu saja. Yang kelebaran tak pernah saya baca lagi. Size canine gigi. Sebab so next I will bend the tag. Lepas tu saya bend dia punya tag. So boleh nampak, jangan follow. Lepas tu dia tag kat dalam. Saya tak guna sticky wax untuk stick. Sepatutnya kena stick dekat sini baru dia akan on hold position. Okay, boleh faham? Okay. So next kita akan buat wire bending untuk label bow juga. Saya akan agihkan wire ya. Kain.
I just paskan. Thank you. Dah. Dari tadi di bawah.
Wah, cepatnya.
Boleh ke?
Tengok top student kat sini.
Janganlah dia. Diva, you dah jadi satu. Hari ini dia tadi tau.
Saya ajak ke depan sini dah start ikut band dah habis dah. Tepuk. Wah, kuat Ain.
Untung dah tak nampak.
Ni semua rabun dah ni. Geng Encik Haripin ni.
Riva, dari sini Canon ni kena sentuh ke?
Ya, kena kena sentuh.
Lateral?
Letter tak sentuh tapi kalau boleh sentuh, sentuh. Tapi udah case ni, letter boleh sentuh.
Ya. Allah.
So, kena bend sampai touch ni. So, bila activate dia kena touch. Dia dah kena ada contact point.
Bila nak settle ni? Dia tadi buat urut-urut tak boleh.
Urut lembut-lembut boleh ke? Urut lembut-lembut pasti jadi. Tengok Puan Horish pun dah hampir nak siap dah. Hey. Cik, bateri ni ada ke?
Dah.
Bateri ni ada ke? Bateri dah habis lah. Cepat habis bateri.
Ini jauh. Dia signal jadi low buat signal slow. Tahu lah. Bateri ada tukar je.
Kak Lim je tutup. Tunduk sampai tak nampak muka.
Tak rabun lah, rabun.
Dia tak nampak mata dia, Diva.
Ni top student kita.
Ni top student. This one.
Kena siap ni. Okey.
Diva kalau ambil gambar selalu ni kena bagi hadiah.
Bukan bagi hadiah, Encik kena bagi hadiah. Sebab banyak saya tengok post Encik punya workshop semua gambar saya tangkap masa ocular. Masih belum claim copyright. So selepas ni semua boleh band lah Hawley retainer. Oh, boleh ambil case.
那 which one you prefer？ 有两个，你懂吗？一个是没有 follow Ash 的，我 ban 多一个。你看你要哪一个？你要给那个听的人吗？然后这个是 follow Ash 的。是吗？我都调转来了，一个是没有 follow Ash， 一个是 follow 雅致。
我觉得我就是个。
你也喜欢那个？好了，就用那个了，不然拿不到分。没有地方是 prefer not follow。Member bagi dua dapat makan extra.
Because I was thinking about if you are doing a shoulder label bow, this is the
Yes.
most comfortable
Yes.
and the passion won't be difficult.
Dapat macam ni okey dah. Aku nak dapat ni. Oh, okey dah ni
This one
cantik.
come up.
Nak dapat lagi.
Kalau dapat, lagi dapat. Boleh touch K9. Selanjutnya kita central incisor dengan K9 kita boleh touch, cuba touchkan seboleh mungkin. Kecuali dia punya tisu dekat K9 bulky.
Tak,
make sure semua tulis nama di bawah model Jangan lupa tiba-tiba pemenang tapi tak tahu siapa pemenang.
Tepi mana boleh?
Ha? Tepi?
Tepi boleh tepi.
Boleh. Tepi ada. Actually tepi ni ada nama saya.
Betul lah nama dia.
Ada kan? Betul lah ada nama saya. Hilang wire. Apa ada rakaman? Cik Rosli buat silat ke apa? Sana Encik.
Mana?
Sampai wire terbang ni.
Lalu dah buat balik.
Dia betul buat dia punya YouTube dia tu. Allah lupa dah.
Dulu.
Betul?
So sekarang sepatutnya kat macam ni kan? So ini sepatutnya dekat upper right. So yang ni akan dari sini.
Macam ni?
Terbalikkan
macam
ni.
tu. Buat patut tak boleh.
Lepas tu ni yang ni upper right, upper left. So dekat macam ni. So kat mark dekat tempat ni.
Paling panjang.
Paling panjang dekat sini.
Mana?
Sampai marking yang sini. Straight line. Dari sini sampai sini. Faham? Faham kan?
Ni lah kan?
Bila letak dari sini sampai sini. Dan garisan melintang macam ni.
Okay. Thank you.
Tidak saya tak. Saya lagi video. Tapi PDF lah. Kena macam mana buat.
Dan saya edit balik lah. Terima kasih.
Petang tak ada.
Mana lagi?
Oh, duit ada.
Wah, tolong lah kak, adjust ni sikit.
Tolong adjust, minta trainer adjust kan. Tengok apa masalah dia.
Salah. Oh, salah. Sini. Sini.
Dah lari-lari dah pula.
Sebab dia punya ni.
Oi, sekarang President Steven, oi. President is the best of the best.
Dia cerita tu tak? Action dah makan kan? Dari saya.
Saya soplok dia kan?
Saya.
Oh, dia terbalik Diva. Kalau kan kita buat macam ni kan. Kalau kita tanda ni dekat sini lah. So kalau kita terbalikkan dia,
Terbalik.
bendanya kat sini.
Betul tadi tu
Ni kat sini. Oh.
Ya.
Faham.
Sebab kadang-kadang kita punya crown size dekat kiri dengan kanan akan lain.
Betul. Tadi
Dekat
kau
apa
sini
tengok
lain.
dekat upper
Itu
left
dah-
ni besar sikit.
Betul.
Wider.
Betul.
Dekat kiri dia shorter sikit.
Betul.
Sebenarnya kita tak boleh ikut standardize.
Oh, sama lah.
Just
Okey. Yang ni tak boleh.
Tak boleh. Diva punya tangan.
di bawah punya tangan. Nanti band banyak kali patah.
Lepas ni ada buat base ni.
Tak payah nak buat sangat.
Tak ada tanya dengan cikgu.
Bass tu semua boleh buat. Yang wire bending yang paling susah. Tapi kita akan ajar tentang the best practice, material practice lah.
Masa saya ada buat tu kan. Participant tu. Cikgu.
Cikgu.
Dia tak tengok tak tengok.
Cik Syam. Okay.
Berpeluh tu.
Berpeluh.
Dan buat baru lah kita kan. Buat dengan kapal.
Masuk. Dah siap? Siap? Hantar.
Dah siap? Okey. Kalau dah siap, nanti letak kat depan sini.
Oh, ingatkan dah siap hantar terus dapat hadiah.
Oh, tak ada. Dapat hadiah sijil. Sijil yang ditandatangani oleh dekan sendiri dengan timbalan dekan. Sijil ni banyak berharga tau, Encik. Dapat sijil daripada dekan dengan timbalan dekan.
Nak seal kan?
Kalau actually better seal lah, Encik. Kalau nak seal, ada Bunsen burner. Kalau lepas dah siap, minta seal lah. Saya akan bagi wax dengan Bunsen burner untuk sealkan. No, seal so that if we adjust, we cannot know which one is their best. Which one is their best wire bending. So once they say we know already this is their position. If they cheat, we can identify one. Cik aja. Oh sorry, ada lighter ah? Derma lah untuk sampai petang. Hasilkan dia punya komponen.
Torch satu ni ya.
Torch. Sorry aja. Encik.
Betul.
Lighter dengan Bunsen burner dekat Encik Rosli. Kalau dah siap, boleh tunjuk ke saya ataupun seal terus.
Kalau dapat wire panjang, cakap aku wire aku pendek. Cepat dah tengok. Sama dah kejap. Apa? Boleh.
Senyum je Puan Hafizah. Boleh.
Lama lah aku buat. Aku dah. Ni kena samakan dulu lah ni. Touch kan?
Touch.
Semua touch.
Dia akan touch dekat center incisor dengan canine memang dia akan touch. Lateral pun kita boleh cuba dia touchkan. Lateral incisor pun kita boleh touchkan. Sebab kalau tengok gigi ni, dia punya lateral incisor memang agak-agak sama dengan center incisor. So kita boleh touch gigi.
Dia ni canine tu canine touch je lah.
At least sekurang-kurangnya touch center incisor dengan canine.
Apa? Salah. This one how I okay ready, but the thing is this one.
Okay, this one.
Oh, is it? Wrong ya?
Mana kan wrong ya? Just kemudian kita sini betul. Oh, why betul nak?
Ada, ini mirip ya.
Ini tu.
Okay. Ke yang yang பல்லு வந்து வெக்ஸ் நைஃப்ல வந்து கோரேஸ் பண்ண சொல்லிட்டு எஸ்பெஷலாக இந்த ரெண்டு இன்சைஸில் அதுக்கப்புறம் இது பண்ணாக்கா சரியாக வரும். அது அவர் சொல்லி கொடுத்தாரு எனக்கு.
Mau teknik dari mana? Dia sudah kunci. Ini betul okey aja.
Okay.
Yes, just masuk.
Okay, thanks a lot.
Nampak?
Saya tengok sini je.
Alah, trainer kena menengok semua tempat.
Dima, pasal dia macam gini. Ni you dia tak cantik. Kenapa you dia tak cantik?
Ini kena pergi balik sekolah ni.
Stres je.
Kena pergi balik sekolah.
Dah besar dah you.
Aduh, degil lah you tu.
Tapi ni panjang sangat.
Panjang sangat. Oh ya. Lepas tu? Wah. Lepas tu? Oh, dia pegang je depan tu, tak apa?
Depan dia pegang macam ni.
Dah, lepas tu baru tu. Tanda. Kena betulkan sikit.
Dia kena betulkan sikit. Macam ni kan, sebab dia terluar sangat. Guna Adam.
Okey, lepas tu?
Just pegang sikit. Masukkan sini. Masukkan ni sikit. Dia akan masuk.
Oh, nampak dia. Tadi kecil kat situ.
Okey kan? So, kalau tight lagi, kita bukakan sikit. Pegang macam ni. Bukakan sikit.
Kita tadi macam mana? Kembangan dia balik.
Kembangkan dia.
Jadi lah. Jadi kat lima.
Jadi. Just kena buat adjustment sikit-sikit je. One knowledge, okay. One day course.
Tek tak kisah dia lupa kan?
Ha?
Tek tak kisah kan?
Kita ikut creativity. Creativity. Kalau nak buat love shape,
Alright.
boleh. Lagi kreatif, lagilah highest chances.
We want the you that
You want me to help?
美啊！你看已经恰恰了，我觉得完全没办法跟不了，恰恰，已经恰恰了，你看整个都不会对吧？你看那个优美，
Oh, you say you look okay.
不够美，
不够美啦，那是
要
okay.
balance 来再 bang 我一个。
这样。
可是走完了哦，一下子，
可以的。
我不能阿嘎那个 U 哎，我要转它从阿嘎到那个 size 啊。
很难的一点，你要一定要
因
experience，
为太久没有 bend 了，完全
一定要 experience。
抓不到它。不美啊，等一下再 bend 多一个，这个 practice 了先，好像越来越热这样啊。Magic hand， 这里没有动到，是不是？这样我这个要出来一点，然后那个给它动，这个给它出上，然后那个给它动，
出一点，
然后那个给它动。
而且这个美，说你的，只是这个也美，只是你 adjust 一点吧。
给它过去，是不是？
多一点。
就是那个圆哦，每次都是这样的，拉不过哎，太久没有用了。Mu ya, teh nanti expecting lah. Oh, baby pun tengah expecting.
See, okay, that's ready.
然后再 bend 进去是吧
Okay.
？Okay, thank you.
So that one look okay, bend nice already. Just need to do some adjustment. Okay, nice. So I still look like you very nice. Not so big.
Tayi is perfectionist.
Perfectionist. Tayi perfectionist.
Saya cuba makanan duduk depan baru.
I follow je before tu. Habis. Sini dia. Tak membantu. Bentuk yang ke dalam sikit. Cuba kita kipas sikit sampai. Kipas sikit ke dalam macam tu lah.
Jangan takut, jangan takut.
Masuk dia air misalkan, balik kat sini macam dia bukan terus macam ni. Apa tu? Ni bentuk ni kan cembung kat sini.
Oh, ada group discussions lah.
Faham tak? Faham tak? Pening lah tu. Ni dia kena
Sama yang ni kita akan buatkan smooth. Cakapnya dah jadi sharp.
naik macam tu.
lekat nanti mark dekat sini. Lepas tu turunkan.
Ini betul lah dia punya band tu.
Tak apalah. Dekat ada band apa. Just proceed je.
Oh, dia kena flow.
Dia flow smooth ke.
bukan.
Sebab kalau ni macam ni, dia takut mereka buat some adjustment, dia akan patah. Belakangan doktor dia akan naikkan, dia akan pegang macam ni. Dan apa doktor buat, dia akan pegang sini, dia akan buka macam ni. Nak aktifkan dia kan.
Dia ada macam tu.
Kerana dia touch kat palate, so doktor adjust kat mulut. Bila dia adjust, takut wire kat sini patah.
Biasa-biasa je.
Alah, motor punya orang tengok.
Lebih besar.
Okay, first case dah dapat. Tapi tag tinggi. Tag tinggi.
Tak tinggi. Okey, lagi.
Apa?
Oh, yang tu.
Makan.
Dulu pun kuat besar dulu. Dulu sebab aku
Dulu okey. Oh, player tu.
biasa. Tapi dulu kuat besar lah pada aku.
So submit. Sudah submit ni.
Sambil sebab ni. Dia buat komen je, dia problem.
Okey, itu je. Veteran.
Ini.
Tak. Ketua Jurus Teknologi akan marking.
Okey. Dah lama kita tak tahu.
Lama kan?
Member almost asthma dah.
Why you are?
Huh?
Want to get asthma already ah?
Almost there. Almost there.
Come.
Dia cuci sampai aku. Make sure dia punya minta semua, make sure dia punya U-loop jangan terlalu panjang ya. Macam seperti saya kata, maximum 2 mm. Maximum 2 mm from the cervical. And the arch wire should be smooth.
Tengok, di depan
Yes. Okay, and then I'm got
Mana punya rapat dah betul
dapat 45 degrees. And I'm got arrowhead on almost wide up பண்ணீங்க க்ளோஸ் பண்ணணும்.
ஆனால் இப்போ க்ளோஸ் பண்ண மொத்த எஃபெக்ட் பண்ணணும் தானே?
அட்ஜஸ்ட் பண்ணணும் எல்லாத்தையும்.
முதல்ல என்ன பண்ணுறேன், லேபிள் போஸ்
நம்ம லேபிள் போஸ். Wire untuk Adam ke label bow? Label bow.
Oh, baby, what is it going on? Oh, your baby. Wow.
Baby buat label bow.
Boleh dah. Tapi dah tahu dah sebenarnya kita top 3.
Top 3.
Top 3 ya. Top 3.
Okay. Jangan risau, ada top student dekat depan. Ada dia punya energy aura.
Hafiza. Hafiza is the best.
Buat Y band ni happy je.
Best of the best. Jangan cakap macam tu jadi Wahyu. Kau tu jadi tu.
Hai, Rudy, wah. Shorter dia kau.
Dah ni bring apa ya? Press பண்ணு எனக்கு. Apa yang direct saja? Yes.
I feel like it's a bit short, really, ya.
Apa yang smooth apa itu dia stretchy Yes.
Mana itu punya keluar?
So in case drawing you are doubt, then you can compensate a bit.
Okay, இது ரொம்ப like short-ஆ இருக்குல்ல?
Then you can guiding a bit.
Okay.
Yes.
So she return back.
Thanks.
Thank you. Panggil orang lebat.
Cikgu aku yang ni, cikgu aku yang seorang lagi tak datang pun.
Cantik.
Macam mana?
Cantik.
Okey. Tapi yang sini dapat ni tak dapat. Ni Isyam ni.
Isyam. Encik Isyam.
Wow, comelnya tag. Oh, nice. Ni tangan orang botol selalu.
Dia tak bagi motivator berhenti tu.
Nama. Patutnya dia boleh bela kan ni tengok tag. Alah ni. Saya nak bagi sama. Alah.
Nice.
Kau tu suruh dia tu feeling lain makan.
Kalau nak Bunsen burner dengan wax dekat depan lah. Makap Puan Nurul malu pula.
Touch gigi first, lepas tu touch gigi first, dua-dua belah. Lepas tu kalau touch gigi second, dua-dua belah. Lepas tu touch gigi third, dua-dua belah. Baru boleh buat YouTube. Baru boleh buat. Baru bila lipas, baru boleh buat YouTube.
Habis dah member laser apa ni.
Kenapa dah?
Sudah umur.
Kita tahu apa-apa. Itu okey. Itu okey. Okey.
这个不 stable，我看这东西都歪的。下面买
Face ah.
member nak plan macam ni.
Sampai duduk bawah dia.
Thanks, Mak. Ha, tengok. Baru nampak. Betul tak? Wah.
So dia
Puan Norish dah collapse. Sakit badan semua dah.
dia dah rasa. Bapa yang Bendy ni kalau tak betul dia punya position memang boleh sakit.
Minta pandangan Puan Hafizah.
Kalau tak betul position masa Bendy wire memang sakit badan.
So inilah hakikat kalau jadi juru teknologi pergigian ortodontik. Balik rumah sakit badan semua.
Wah, sekejap boleh siap tak?
Sebab ni tak adjustable.
Dan kena sentuh kan?
Ya, dia kena sentuh. Sebab dia punya central incisor dengan K9 dia selalu a bit depan compared to lateral. Tapi untuk case ni even lateral incisor pun kita boleh touch.
Orang buat kerja dia makan, orang makan dia buat kerja.
Siapa? Boleh? Tahu lah pening kalau tak.
Sebelah jadi, sebelah jadi. Itu lah.
Sebelah jadi
Ini
sebelah
okey, just another side sini dia kecil.
jadi.
Tapi boleh lah.
Dia sengit.
Kita boleh adjustkan sikit. Saya tolong adjustkan.
Gelincing.
U-loop dia kena besarkan sikit.
Main dengan wire ni sebab wire ni dia licin tau. So dia pegang dengan jari
Kan
licin.
Hawley ni pakai 0.5 ke? Dah tukar?
Dia bilbo lah?
Haa.
Tak, 0.7.
0.7 eh?
0.5, 0.6 boleh guna. Tapi dia kena modify dekat dia punya U-loop sana kan. Kita akan pakai tube robot retractor.
Oh, lain pula.
So dekat sini dia akan ada robot retractor. Bakal tube dia. So dekat sini dia akan halus 0.5 mm. Dekat sini kita akan selitkan satu tube.
Lepas tu?
Yang soft kita akan bend dia punya dekat sini.
Tube tu stainless steel lah.
Stainless steel 0.7. Supaya dekat sini dia boleh rigid. Depan dia akan jadi macam lembut, fleksibel sebentar. Lepas tu dekat sini
tu dia rigid.
So yang tu jenis orang kata Hawley with buckle retractor lah.
Ada.
Ada.
Dia siapa lama pakai yang tu. Ini ada benda lain. Betul, Diva punya pendek je. Betul aku panjang je. Betul. Dia pendek je.
Kita cuba adjust macam ni.
Lepas tu
Kita cuba bend.
Lepas tu dia bila bend pakai hujung ni.
Pakai hujung ni.
Tapi tak tajam.
Tak macam ni.
Tapi jangan
So
tajam.
jangan tajam. So jangan tekan kat sini. So tekan kat sini dia akan jadi tajam. So kita tekan kat atas slowly.
So dia bengkok je lah.
So dia automatic dia akan jadi short. Dia punya U-loop akan jadi short, akan jadi panjang.
Faham.
Dia akan jadi macam ni.
Kecil sikit.
So, saya ada buka banyak. Saya letak kat sini. Saya closekan balik.
Tolak ke dalam.
Nampak tak?
Gila tu, jadi
Macam ni. So just main adjust sikit-sikit macam tu je.
Boleh. Thank you very much.
Oh, Puan Yongkai sampai duduk ke bawah dah. Ben.
Semangat dah.
Semangat.
Of course.
So the U loop will be different size, or
Yeah, usually actually they will be the crown will be same size, but in some cases like this cases you can realize that the upper left and upper right have different. Like upper left is slightly wider compared to the upper right, so then your U loop will slightly have different a bit.
so slightly bigger should be fine.
Yep.
Be symmetric. Okay, member done.
That's why you need to based on each model, each patient have different.
Oh, okay.
Some patient both sides will be same, not much different. Some patient one side canine is bigger than another side.
You measure this way, right? The U loop.
Yep. It's supposed to be like this side. This one supposed to be here, so it will be here. Because we supposed to be like this, right? Return, it will be like this.
Okay, so I measure.
From here, from the highest peak point until this horizontal line. So you mark.
And then make the U loop. Okay.
Some people they confuse. They just now they go to other side.
Yeah, turn the other side.
If both side canine is the same size, wouldn't be have an issue. But for this case, the patient upper left and upper right have a different size of canine. So the width of the U loop will be different, slightly wider and short.
Kena buat sebelah-sebelah ini, Pak.
Kita settlekan sebelah dulu, one side. Dah settle sampai tag, baru bend another side.
Boleh sampai tag baru boleh buat sebelah.
Actually, it depends on individual. Certain people mereka nak buat dua-dua macam tu.
Sekali jalan.
Sekali jalan, kalau mereka boleh jalan macam saya akan settlekan satu, baru have go another side. So macam kita buat dua-dua macam tak balance, susah pula nanti. So better kita settlekan one side, tak fikir one side dah, then pergi dekat upper left ke upper right.
Baik.
Kalau tak dua-dua halfway, kita pula pening.
Kiri jongkit, kanan jongkit. Benda tak siap. Betul, dah jongkit dah.
Dah jongkit dah.
Lipik kiri, kanan jongkit. Lipik kanan, kiri jongkit.
Sebab tu kita kena balancekan dua-dua. Kalau one side dah settle, semua should be okay dah.
Nak balance lah dia orang tak biasa.
Tengok baby cantik dah dia buat. Touching almost semua.
Whoosh. You are shake.
Betul. Actually touching almost touching semua dah.
Boleh buat makna.
Touching 6-6. 3 to 3.
Ada tambah tak faham? Ada tambah tak faham bertanya?
Cek dulu. Cek dulu. Cek dulu. Ada recording kat belakang. So at moment semua fahamkan dia punya konsep. Kenapa ada arch wire yang smooth, kenapa dia kena ada U loop, dan U loop kenapa kena 2 mm below the cervical and should not touch the tissue. Faham tapi tak pandai buat lagi. Practice make perfect. Kayu masuk auto. Dekat nak je diam je ini.
Masih. Ini besar.
estimate I see if the width is slightly bigger means then I will take a plier, spring former. I'll just put here. Here. Then I see like it looks smaller, so I bring in a bit more to make it wider. Yes. If not enough, then I open up a bit. Right?
Thanks a lot.
Ngam-ngam.
Dimas, ajar dia kali. Dia tak nak dengar cakap aku.
Jangan marah. Relax. Jangan gaduh-gaduh.
Macam nak buat YouTube-nya.
Okay, kalau macam ni, kita tak boleh buat marking. So, kita akan terbalikkan. So, ini suppose to misal kan. Kita akan terbalik, letak macam ni. So, mark dulu. Dari sini.
Marker tu.
Buka galah.
Dah.
Oh, ini highest peak point kan. Ini highest point. Lepas sini. Mark. So, yang ni, ada side.
Boleh. Oh, ayah.
Oops. Mana satu Ada dua.
Ada pen biru.
Bukan ni pun. Ni. So kita akan markkan another side. So baru kita akan bend. Tapi yang drawing kan ni saya terlalu panjang. Sebaiknya dia ada kat sini. Tapi kat dah bertegang 4 mm dah. So kena pendekkan sikit.
Ni pensel.
So ini sepatutnya sebaiknya dekat sini je. Dia wire dia kena macam ni je. Tak perlu panjang sampai sini.
Pendek je.
Pendekkan U-loop dia.
So nanti bila kan nak buat U-loop, balikkan macam ni. Kejap.
Bend dua side-nya U-loop, baru letak balik. Tapi kena estimate dia punya guna spring former estimate. Tea time dah ada Sambil-sambil buat label bowl, siapa nak minum tea ke boleh lagi sekejap kot. Dah ready.
Daripada marker ni macam ni. Potong sikit 2mm kan. Nak buat U tu sebab panjang tadi.
Sini. Dia tanya aku.
So kita akan letak dekat sebelum marking point tu.
Ujung ni. Ujung aku panjang. Jangan ambil bawah.
Kau yang baik kan? Kau ambil yang mana? Yang tengah-tengah ni ke yang ujung belakang?
Sekarang ni kau kata garisan kau ni salah. Cuba betulkan yang sebenar-benar.
Ada dah ya?
Okay ya.
Okay Raya.
Just punya tissue touch pun. Next time don't touch the tissue. Side open up.
Ya.
That's okay.
Okay Raya.
That's good to go. That's good to go already. Just bend the tag.
Ya. Thank you.
Elok je panjang tu sama.
So aku
Jangan stres.
stop
stres lah, dia terjongkang-jongkit.
Ada pakar kat sebelah, kenapa risau?
Ai pun tak jadi. Tak tahu kenapa hari ni tak jadi. Kes tak jadi tadi. Kuat.
Boleh sikit.
Tapi daripada ikannya.
Ikan ada tak?
Sebelah sini. Lagi pendek dari sebelah sini.
Saya buka balik.
Susah sangat.
Iya. Kau balik. Ni sebelah sini. Kau jaga.
Mana tak stres ni dah. Aduh.
Sampai wire saya tak jadi sebab kemarahan orang belakang. Tak jadi wire sebab kemarahan orang belakang. Degil. Wah, degil ni. Dia degil ni hanya. Oh, degil mudah. Enggak.
Taklah pun.
Memang berat pun. Enggak nanya.
Lambat ni.
Oh, itu pilih apa? Apa?
Tak pilih.
Asal pagi-pagi hari.
Ini belum kes ni kau nak petang. Esok nanti siap.
Aduh.
Aku rasa saya nangis.
Oh, ini nangis.
Jangan kacau dia.
Satu lagi putih.
Jangan kacau, jangan sis.
Ini mati oh. Kalimah dari mana dia? Baru pergi head call. Kau pergi kena maki sendiri. Bawa kereta kan? Nanti kat traffic light memang lah. Wah, aku pula dia kata.
Ya. Kau cuba adjustkan dah. Dari sini. Dari sini cuba turunkan. Tapi kena hati-hati sikit lah. Dia memang dia tak touch kat kanan. Kalau touch kat kanan kena adjust lagi.
Setting gigi pun dah jadi. Nak tekan sikit.
Saya dah turun adjust dah. Macam ni. Adjust dari sini. Bend ke bawah je.
Ya Allah.
Kenapa? Apa jadi? Happy sangat.
Pendek. Okey. Asal pendek lu aku. Pendek juga. Tapi dah cantik kan ni pendek. Boleh je. Cantik dah lu aku. Tak. Siap aku. Mana pendek? Ni dia suka aku pendek kan. Aku pun pendek kalau sikit. Pendek.
Ini memang pendek.
Aku tak percaya dia punya garisan tu. Yang situ? Oh, panjang, pendek. Aku tak percaya garisan dia kena pendek je.
Buka balik je.
Cantik lah dia kacau.
Cantik dah you aku.
Aku jangan kacau boleh tak? Don't disturb me. Tadi saja siap pun nak lah ni.
Kalau tak top 3 ni, you ada tolong aku tak?
Mana? Dia nak top 3.
Yang tolong tu semua saya potong markah.
Jangan lah. Kita budak-budak baru belajar. Kita BBNU. BBNU.
Kau lain.
Budak-budak baru nak up dah. Betul lah. Budak-budak baru nak belajar.
Sama lepas tu melancong tu lah.
Tak sama. BBNJ. Dia dua sama kalau orang cakap dia betul.
Keren ke?
BBNP. Budak-budak baru nak belajar. Ni nak up lah. Dah 20 tahun kau tak pegang. You jadi. Iya.
Yang
Lebih tu. 20 tahun.
Cikgu garang ya kak? Boleh tak dia 5 minit je?
Tak boleh. Dia
cakap lagi tak jadi. Ni kena bising ni. Baru saya jadi buat kerja.
Hello.
இந்த கம் டச் பண்ணதுனா தெரியுது.
Okay. Belum lagi.
Kita tengok post basic punya.
Ya, Encik.
You cakap tadi step pertama ni, sorry lah kalau I tanya balik I boleh nak buat.
Tak apa,
tapi
boleh je.
Tapi I nak ikut teknik yang you ajar. You ajar ikut follow dia tak
Highest cut,
kan.
initial cut and distal cut.
So dia punya bridge pula akan separuh. Dia akan separuh daripada gigi. Separuh daripada gigi.
Ya, betul.
Bila yang ni dah siap sampai sini, yang ni okey, yang ni gigi ni kalau dia menghala ke depan begini, dia shift ke depan. I kena buat dia punya bridge masih lagi kena.
Bridge ni kita sebelum itu kita akan cuba buat macam ni.
Kan?
As much as possible, sebab in case kalau ni bukan normal label, normal Hawley retainer, normal Hawley retainer dia akan sampai K9 je. In case kita nak solder, kalau benda ni bengkok sangat, kita nak solder dekat sini, kita nak adjust wire dia banyak susah.
Betul.
So as much as possible kita try to compensate, balancekan dia, cuba macam ni.
Walaupun
kalau
gigi dia rotate macam mana
sikit,
pun, macam mana pun kita akan cuba balancekan dia. Kalau memang tak boleh, then only kita follow dia. So bila kita cuba nak buat macam tu, akan ada kawasan yang sebelah tinggi sebelah rendah lah kan.
Betul, sebab kita bila ada compensatory curve, one side dia akan jadi shorter sikit.
Ya, betul.
Initial dia akan tinggi sikit, distal akan shorter. Jadi kita nampak dekat sini dia shorter sikit, dekat sini tinggi.
Okey. So seterusnya lepas tu kita dah bend, you ada terbalikkan macam ni tadi kan?
Betul. Sebab kita nak bend macam ni, makin susah. So kita akan terbalikkan.
Kemudian tanda kat sini kan?
Betul.
Kalau tinggi sikit daripada separuh pun boleh?
Tinggi daripada separuh boleh juga. Boleh juga.
Ini pun tanda kat sini.
Tapi as long jangan lebih tinggi daripada cusp. Yang disiapkan dengan cusp ni.
Ya.
Kalau tak, bila dia punya lower bite, dia akan bite dekat wire. Dekat bridge. So patient tak boleh tutup mulut.
Yalah, ada high bite lah kan.
Jangan jadi high bite.
Lepas tu buat apa?
Lepas ni tentang material, yang tu saya akan bagi short lectures untuk material. Lectures dengan ada quiz. Ada satu quiz.
Dia masa nak tadi
Kalau hand sew dah.
tu akan nak lap jap lah.
Sebab untuk Hawley kita mainly dua Adam dekat 6 molar dengan label bow.
Lepas ni lecture ya, pasal
Dah seal. Dah seal.
belum nak seal, baru nak seal. Nak seal, baru nak seal. Ada wire kita wax. Wax.
Balik bagi Paul ni.
Trainer dah. Okey, boleh bend dah lepas ni.
Nak hantar kami buat 2 bulan lah.
Apalah kita for the first time kita boleh pergi 2 bulan, lepas tu 1 bulan, lepas tu 1 minggu, lepas tu 1 hari, lepas tu dalam berapa jam. Foto dia hantar pukul 9 pagi, pukul 2 petang, 2 petang, pukul 1 petang nak ada Hawley retainer. Nak buat impression pun dah 30 minit.
Masa dia waktu memang kena mati.
Lepas tu buat panggilan call non-stop. Dah siap ke? Dah siap ke?
Yang ni lah misteri ni mesti marah lah. Siapa suruh guna rekron bakar dengan rekron ni? Where is your wax knife?
Itu zaman dulu, zaman sekarang boleh tak?
Nice your legs, nice.
Where is your wax?
Kabiza je. Ali dah rumah tak? Lagi tu balik. Kereta kat situ. No, kereta kat situ.
Empat setengah ke?
5 o'clock.
4.5.
Member punya line draw sengit, bukan band sengit.
Bukan mata sengit semua kan?
就是那个 line 歪了，其实还在中间啊。
中间啊。
我要 steam clean 啊。Malas anak-anak.
Apa yang tinggal sekarang?
Nice one. The first baby boy. The one just now we adjust one.
After graduate so many.
No, the edges just now we adjust one that one. No, I said nice one. That you look.
Tapi you look sengit sikit lah. I think last time in Masa better lah. At least it's 我喜欢是这样直，然后这里圆圆美美的。
哦，圆圆 cute 的。
一定美美的，以前单刀，可是现在。
但是你要看它的牙齿的 size，有时牙齿 size 还 OK。
可是我的现在是，我觉得有不 OK 啊，你们看不到啊，我自己看到啊。I feel like sengit. Sengit, I cannot see anything sengit sikit. Baby pun tak boleh.
Dan dari yang ni.
Ada dari di mana?
Ini I got write your name.
Agak.
Saya suruh satu nak you got write apa? Dia nak ambil apa di luar? Baik, dah siap ke? Siap. I take my own picture first.
Yeah, this one.
哪一个？真像我的。
Foto. Siapa dah siap?
Boleh ke dia buat sini? Dia dah jatuh dah. Benarnya.
Jatuh. Kita kena adjustkan balik dia.
Sebab dia dah kan?
Sekarang okey dah.
Dah. Lepas tu? Dah. Dah.
Okey kan?
Jadi?
Okey kan? Puas hati kan?
Baiklah, dah benar dah ni. Lepas tu? Dah.
Dah, seal je.
Seal je. Seal je. Pakai apa?
Pakai bags dengan dekat interdental dia. Dekat interdental.
Interdental tengah-tengah ni lah. Ni. Ni.
Dekat sini, dekat sini lah interdental.
Dia macam jarang-jarang. Aku apa ni bang? Sedap tu aku jadi tangga. Kau dah siap bang? Aku ini buat tangga.
Sil pernah lah. Kau sabi bangsa pernah? Dengan air ke? Nasi lah.
Ada yang satu.
Mana? Lighter.
Okey, lagi 5 minit material punya material lepas tu material sekejap je lepas tu summary dan tengok semua dapat grab tak?
Ada kat sini. Di bawah dah. Di bawah itu sih interproximal dia.
Interproximal lah. Interproximal. This one put here. Auto one separate.
Tapi saya tak tahu lah ni kalau marking dapat berapa markah. Awak dah.
Auto no need to. Because
Wah, tu sandwich.
Tapi dah lapar lagi.
dekat sini.
Betul kat sini.
Motornya dikecualikan untuk pemakahan.
Aku tak sibuk, just lekat. Tak pengen.
Kakak tak lekat istilah Kak Sal Pro dah. Kak Sal tak lekat sebab Pro lah.
Letak je terus duduk. Letak je terus duduk. Pasal tak perlu seal.
Siap dah sana kat ni.
So at least now we can understand already that the wide bending technique.
Yeah. But I think practice makes perfect.
Yeah. At least you get the idea and pictures how to bend already.
Yeah, very true.
Sample mana? Boleh hati stiker.
After 17 years, I'm doing Adam's plier.
After 17 years.
After 17 years.
And that's a good
Last
practice.
I did when I was in Penang.
Dah, jom dah. Apa yang hantar? Tak nampak.
Aku jadi ni juri luar ni. Juri luar.
Di bawah marking pada dia kurping lo.
Itu lebih kurung.
Okay. Remembrance ke?
Semua tengok hasil kerja kawan-kawan.
Tapi saya punya memang cukup lah. Oh, cantik lah pasal kan.
Encik Rosli dah buat belon? Oh, ada kan? Okey.
All this auto control. Tengok. Staff auto kan, you look cantik je. Ha. I boleh tak.
Fikir pada kamu dah tinggi.
Mana cantik abang. Saya sedar
buat
diri.
pertama-tama. Fikir.
Saya sedar diri.
Dia tak mekat. So, tak tungkat dia.
Tak adalah comel.
Kerja sini apa silikon yang Castrogel.
Saya dah lama tak buat Kak Sal.
Saya pun dah lama sudah tak buat.
Percaya ke Abang Rosli lama tak buat?
Sebenarnya aku pun dah lama tak buat.
Diva, yang ni kita tak buat kosong. Tak buat kosong kan.
Holomnya saya setelahnya untuk working model saya tak akan buat kosong. Working model untuk saya akan buat heavy punya.
Dia berat sikit.
Berat. So rasa kena kuat lebih lah.
Ni print kat mana ni?
Dah. Pening tengok kan. Kat sana apa?
Yang ni lah.
Kat mana?
Terus ni. Yang ni lah. Duplicate dengan articulate sekali.
Ni
Apa lama tapi saya articulate sekali.
Okey lah, dia punya
Articulation.
Dapat sijil.
Tak apa. Be careful di bawah.
Wire just now
Yeah.
kacau.
Yes, why?
Dangerous. Oh, yang melintang-lintang ni. So nice. Dia kait. Keli dia.
Yang ni saya buat hollow. Yang mesh first. Hollow mesh. Okay, sambil-sambil kita buat wire bending, kita akan go for next module. Saya rasa kebanyakan semua dah siap dah. Hawley dengan Adam. Semua cantik kan?
Kemas.
Semua kemas lah.
Kemas.
Oh, baru training sehari dah. Mas Hamid, Puan Hafiza dah hantar ke?
Dah hantar ke?
Belum?
Mana?
Oh,
Ni lah.
dah tulis nama kan?
Dah.
Dia tak ada masuk dalam ke? Ni je lah.
Kita asingkan auto, kita asingkan. Auto kita asingkan sebab dikecualikan. Terus ni.
Kayu moi.
Mana Kak Fiza punya?
Maki lah sekali. Maki.
Mana tahu?
Tak boleh sekali.
Kak Fiza ni ke?
Oh, mana tahu Encik Rosli dapat pertama challenge. Best challenge dan auto.
Okay.
Saya paling lambat baru makan.
Okay. Semua diminta duduk. Semua diminta duduk untuk kita pergi ke final phase kita. Morning kita dah buat teori, lectures berkaitan dengan introduction. Dengan second kita dah buat tentang dia punya ideal requirement, module 2. Yang ketiga kita dah buat hands on. The next we will introduce about the best material practice. Untuk base plate, in market kita bernampak ada banyak jenis. Yang very common kita use adalah heat cure. Is a polymerization technique such as this. And the second material is cold cure, that we call as a mask technique. That is we use the powder and liquid to mix together for the cold cure. The third material is a light cure. Dekat Malaysia memang saya pernah nampak sekali lah. Lepas tu supplier tak nak mau masuk sebab one is very expensive, and second thing is sebab no demand. So bila expensive, then they want to bring in, kena ada demand daripada lab, clinic or daripada lab. So bila tak ada demand, dia punya supplier dia tak nak bawa masuk. Yang ini dia akan gunakan sistem manipulate, which is like your same like our base plate like your. After you pour, you just adjust, adapt everything, put inside the like your machine. This one. But this one like you cannot use much because it's just a small tube like that only. It's soft and it's very expensive. Like for like this kind of autoclave resin, you can do at least 100 retainer. This one I think not even 30 or 20 like that only.
Flowable lah.
Huh?
The light cure flowable.
Yeah, it's like flow, it's like a gel like that. You flow it, then you just adapt, then you can trim already. And it's not worth it. That's why they don't want to bring in. It's very expensive. And the last one is the most famous currently we are using is the auto resin, which we call it an addition technique. Got a few name for that: addition technique, sprinkle technique. Some they call it as a salt and pepper technique. So don't confuse. Like first one is a heat cure, which we say is a polymerization technique. So some journal you look, they say polymerization. We apply the polymerization technique. They won't say we use heat cure technique. And some for the cold cure, they use the mask technique. So you saw in the journal, it's a mask technique, means it's a cold cure. Third one is a light cure, which we use the UV light to cure it using the light cure machine. The last one is auto resin, which we use in like most of the auto lab for the Hawley retainer, or we use the auto resin, which they call it as an addition technique or sprinkle technique or salt and pepper technique. So this actually same thing only. If you use the autoclave, it's more clearer compared to cold cure. Yeah, there's a difference, the quality. So we prefer to use the auto resin to create all the base plate. You can see the heat cure is more clearer. Actually heat cure is very good. The only thing is just time consuming, because you need to cure for a few hours, then only you need to invest everything. So it takes a lot of time for heat cure. But the quality wise, the durability wise, is having the highest strength. And the clarity, the clear is more transparent compared to things. Cold cure you can see a bit cloudy.
Yeah.
It's not so clear. Third thing is the light cure. Light cure is very clear also, but it's very expensive and it's not worth it if you are in the private lab things. And lastly, is auto racing is clear enough, but compared to the heat cure, is slightly lesser the percentage. The degree of the clarity is slightly lower. Okay, for the final task, we have done the 2 quiz. Now we go for the final quiz. So at this moment, got any questions? No, right? For the module 3? No. Okay, start to scan.
Start to play game.
Wah, everyone excited, eh? Semua dah join? Okey, kita tengok kali ini siapa juara bertahan. Setakat ini quiz 1, quiz 2 Cik Dalila, Siti Dalila dah menang. Quiz ketiga, tengok ada tak next champion. Gambar deh, satu question je. Okey, 12 semua dah ada. Wah, semua dah main ni, main smiley semua. Okay, semua ada? Semua dah join lah? Okay, start lah. Okay, saya tunggu sekejap.
See all the names are there. Semua nama ada. Berapa orang? 13.
Tunggu sekejap lah.
Check the participants, all the names are there.
Okay, angkat tangan lah. Samira.
Yes.
Ada, yes. Muhammad Ramli. Oh, Encik Mat. Boleh kasih tulis Muhammad Ramli. Encik Mat. Yes. Puan Nur Nadia. Fokus, fokus. Puan Nurul dengan Cik Raja. Okey eh? Semua dah, kita tengok pemenang siapa eh? Jeng 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 jeng. Coconut sustain siapa tu? Who's coconut sustain? Raja, Cik Raja. Okay, not bad. Kali ni pun Puan Siti Dalila, Cik Siti Dalila juara bertahan 3 kali berturut-turut. Okay, so kita dah habiskan kita punya 3 modul. So now I will do a summary session to go through. Okay, daripada modul pertama kita nampak kita summarizekan. So the founder kita adalah Dr. Charles Augustus Hawley. Semua ingat lagi kan siapa dia founder? Dan types of Hawley retainer: Hawley with short label bow, long label bow, soldered label bow, acrylated label bow, and split label bow. So selain daripada ini kita ada juga banyak Hawley retainer yang daripada family Hawley, di mana macam back retainer, reverse U loop, yang semua tu consider under the family of the Hawley retainer. Tapi yang most common Hawley retainer, Hawley with the short label bow. Lepas tu dia ada Hawley with the long label bow, Hawley with soldered label bow, acrylated label bow, split label bow. Yang ni yang paling commonly used in Malaysia. Yang reverse U loop pun ada, back retainer pun ada, but we didn't put here. Okay, and third thing, advantage and disadvantage. You all remember?
Yeah.
What's the advantage?
Advantage of
Hawley retainer.
highly durable.
Highly durable. Disadvantage?
Expensive. Expensive.
And costly. Yes. So the usage, you all remember?
Both also acceptable.
Both also acceptable. So there's no rule saying that you only need to wear full time or you need to wear only at the night time. But based on the depends on the clinician. If they advise you need to wear full time wear, then you need to wear full time wear. But according to the journal, even it's after 6 months of full time wear, you wear a night time wear, it's still acceptable and not much changes in the movement of the teeth. And just now the last quiz, the primary component. Remember right? What's the 3 components?
Label and base plate.
Okay, correct. Pandai dah. Lulus dengan cemerlang. So next. So now, are you able to explain the history of Hawley retainers? Can? If we ask the question about who is the founder, you all know, right? Then you're able to identify the type of Hawley retainer.
Yeah.
How many type of Hawley retainer just now I explained. Did you able to articulate the advantage and disadvantage of the Hawley retainer? Like what you're mentioning, expensive, durability is for the advantage, disadvantage is costly. And the usage hours?
24 hours.
Okay. And you can describe the 3 type of components? Yes. And did you able to design and fabricate Hawley retainer? Just now you do wire bending, you all can do, right? Yeah. So boleh hantar kes dah lepas ni. So nampak tak senyum? One more case. That. So before we want to end the session, I want to ask whether you all have any questions
Q&A.
that you all want to have any questions after the overall the 3 modules. You all want to ask some kind of question that maybe
I like the quiz.
you like the quiz. Okay, thank you for the compliment. And that's the compliment. Kalau you got any questions? Ya, Encik Mat.
Saya tak tahulah saya tanya. Kalau ikutkan dia pada usia berapa yang agak kita tak boleh pakai braces lagi? Braces yang fix lah.
Ya, fixed braces. Usia berapa dah boleh pakai?
Maksud saya pada last
Setakat ni saya nampak even orang dah hampir nak pencet pun ada yang pakai juga.
yang pension pun ada pakai juga.
Saya pakai, tapi kita kena tengok dia punya periodontal health. Tengok dia punya gum reception ada tak apa semua. So the doktor akan tengok kalau gum reception dia teruk sampai boleh nampak dia punya root resorption, boleh nampak dia punya tissue resorption dan dia punya gigi goyang, then it's not advisable. Sebab bila kita guna braces takut dia gigi patah ke keluar ke macam tu. Tapi even saya nampak umur dah hampir 55, 57 pun ada pakai braces. Even staff Universiti Malaya kita punya OS punya ada seorang nama apa pun tak tahu, Indian, dia umur rasa 55, 57 dia pakai braces. As long dia punya kesihatan gigi dia okey, dia masih boleh buat treatment. And terima kasih Cik Mat tertahan. Based on my understanding tak ada limitation as long clinician rasa dia tak ada masalah periodontal health. So, yeah, have a good oral hygiene. Kalau pakai braces memang kena ada good oral hygiene. Okay. So, before I conclude my session, remember the best investment you can make is an investment in yourself. The more you learn, the more you earn. In other words, the more you are learning from what today you are doing, you will earn a lot. So the learning is a progress, a continued progress. Don't limit yourself. Sky is the limit for you. If you dream, go for it. Make sure your dream as an action and your action to achieve what you want. Make it realistic. So that's where I want to end my session. And this is the reference, all the journals which I have referred to. Because sometimes it's not like based on experience only, it's all the clinical findings, all the evidential base. So all this is the reference that I took from the journals. Okay, that's all. Thank you so much. And finally, before I end my session with everyone, and thank you to participate for this one-day training. Hope you all enjoy. You all enjoy? Yes. Okay, thank you. Balloon, yeah. Next I'll go for balloon. So please take all your balloon.
Kita ambil satu.
你会拍 baby 会拍吗？假如
不会不会不会。我觉得他不会啦。
So tolong reflect balik kamu punya balloon. Apa yang kamu expect achieve tak? Achieve. Kalau achieve, blast. Wait don't blast first. Okay. Everyone come together. Everyone come nearer a bit. Oh, you all can come this side. All come here. All come to the front. Semua pergi depan. Dah achieve kan expectation. Okay, bawa pergi depan. Kalau kasar takut, kasar tak apa, kasar boleh undur ganti tak apa. Kasar takut kau. Okay, cepat. Okay, Kafiza. Ini siapa punya? Okay, saya akan cakap 3, 2, 1 Okay, semua tunjuk kamu punya balloon. Kanat, masuk je. Kanat masuk je. 1, 2, 3. Buat selfie. Okay, aja masuk. 1, 2, 3. One more, 1, 2, 3, freestyle. Okay, 1, 2, 3. Okay. Before kita belajar. Okay, so you want me the explanation. Semua happy ya, So, Encik Najib, saya ingin jemput Encik Najib untuk datang sekali.
Tak mana?
Entah sini. Entah sini.
Ada kat tepi. Boleh kan? Kat tepi.